Stanley kicking us off. She is the chief of the Division of Pediatric Endocrinology at Mass General Hospital for Children and an associate professor of pediatrics at Harvard Medical School. Her clinical research, in addition to characterizing the endocrine and metabolic profile of people with Williams syndrome, include better understanding endocrine abnormalities in obesity, HIV infection, and non-alcoholic fatty liver disease. Welcome, Takara.
Thanks so much, everyone. It's really a pleasure to be here. So here's what we're going to do today. I want to first spend some time talking about the variety of shapes and sizes of people with Williams syndrome, discuss why some of those we might worry about as doctors, talk about some approaches to underweight and overweight. And the main point of this talk, actually, and you're going to have another talk later today about this, is to really remember the importance of physical activity for all of us, people of all shapes and all sizes, and really all of us, because it has a bunch of health benefits. So as you all know, children and adults with Williams syndrome have a variety of body shapes. Some are thin, some are bigger, just like in the kind of general population. Although there tends to be a lot more thinness, especially in childhood. And babies with Williams syndrome, most babies are born what we call small for gestational age. That's what SGA stands for. And most children with Williams syndrome remain small, so both low weight and relatively low stature. These growth curves are from the Williams Syndrome Association website, which is amazing, and which you've already heard about. This is girls on this side. You can see my arrow, yes, okay. And this is boys on this side. The gray is people without Williams syndrome, and the pink is girls with Williams syndrome, and here the gray is boys without and boys with. And again, the higher you go on this side, the higher the weight is. So you can see that on average, people with Williams syndrome stay thinner throughout childhood. Then starting in adolescence, clinically, we kind of see a divergence. So some people stay really low weight and others gain weight and may develop overweight or obesity. So Dr. Pober this morning already mentioned the SHAPE study, and these are some more data from the SHAPE study. Just to let you know, there was a slight predominance of females in the SHAPE study. And again, what we call this, so this is body mass index. The range was from 16.7, which is really very thin, up to 55.5. And so that's a broad range of body weights and body shapes in the people with Williams syndrome that were studied. What this graph shows is this is 100%. Okay, each bar adds up to 100%. This is the United States population in 2017 to 2018 adults. Blue is the proportion that were underweight. Orange is the proportion that were, quote, normal weight. I don't really like that term, but I couldn't think of a better one. Green is people who had overweight, and blue is people who had obesity. So if we look at Williams syndrome, males and females combined, you can see that there's a lot more underweight, about 5 times the amount of underweight. So again, people are starting small and continuing to be small. The amount of, quote, normal weight is about the same. The amount of overweight is about the same. And the amount of obesity is actually less than the general population, although it's not news to anybody in this room that as a population, we are struggling with obesity. This breaks it down to males and females, so slightly more females underweight than males with Williams syndrome, and more males here in the overweight range compared to females. But in general, we have still a large number of underweight and some problems sometimes with overweight or obesity. I'm not going to talk much about this, but I do want to mention it. In some people with Williams syndrome, we see what's called a lipedema-like phenotype. Lipedema is something that was defined in adults, almost always females, and these people do not have Williams syndrome here. When we think about people who have kind of swollen legs, most of us are thinking about something called lymphedema. That relates usually to circulation. And you can see that this person, again, who does not have Williams syndrome, has swollen legs, and you can see that their feet are also swollen, right? Now, this is lipedema. It's not an issue with circulation. What it is instead is kind of an accumulation of fat tissue in the lower legs here. It can also be in the upper legs. It can be in the upper arms. It can be in the lower arms. Most commonly, we see it in the legs and sometimes in the arms. And you'll notice here, we call this kind of cuffing or shouldering. So you notice the feet are not swollen, right? So that's how, as a doctor, I would differentiate between somebody having lipedema or lymphedema. So again, lipedema is excess fat. And I've worked with Dr. Pober for a long time, which has been a great privilege. And she's the first one who noticed that people with Williams syndrome also tend to have lipedema. So this actually is I actually don't remember now. One of these is a male and one of these is a female. And you can see this same kind of looking like lipedema. And you saw that also back on some of these pictures. This person has lipedema. This person maybe a little bit. So it's something that happens sometimes. It doesn't happen all the time, but it can happen in people with Williams syndrome. And unlike what we see in people without Williams syndrome, it occurs in both men and women. And in kind of people without Williams syndrome, it tends to be really painful. So when people touch the legs, it really hurts. We've heard that in a few people with Williams syndrome, but that's not what we hear as commonly. Typically, it's not reported to be painful. And that could be because people with Williams syndrome have a higher pain tolerance, or it could be that it's a somewhat different thing. Okay, so we've established that people come in all kinds of shapes and sizes. And I just want to state up front that my opinion is that our culture has way too big of an obsession with what size people are. So my goal is not to make someone a certain size or a certain body weight. As a doctor, though, we do sometimes worry about certain body shapes and sizes. And that's because if you have either really low weight or really high weight, it may mean you have an underlying medical problem, or it may mean that that weight itself is causing an increased health risk. So that's what we're going to talk about next. So if someone is underweight, most of what we worry about is whether they're underweight because they're malnourished. And that's really what contributes to most of the risks of being underweight. However, we do know from studies of the whole population that being underweight itself can actually increase the complications from illness or surgery or injury. And part of a way to think about that is you just kind of have less reserve. So if you end up in the hospital for a couple of weeks and you're already underweight, you might be at higher risk because you don't have kind of stored calories, if you will, as reserve. It is also true that people who are underweight tend to also have less muscle mass, and that can be associated with decreased strength and decreased function. So it could be harder to do something that you want to do. It could be harder to participate in a game or a sport. It could be harder to lift things as you get older, things like that. And then we also know that people who are underweight on average have decreased bone strength and increased risk of fractures. And I'm just going to say right now, for the first of probably 30 times in this talk, one of the main reasons exercise is really important for all of us, including people who are underweight, is because exercise increases your muscle mass and it increases your bone strength, right? So you can address these two things with exercise. On average, when they do studies in the whole population, people who are underweight, if you compare them to people in the kind of quote normal weight or overweight range, they have an increased risk of dying. That said, there's probably a lot of other factors here. Some people, not people with Williams syndrome, but in general, some people are underweight because they have an underlying illness that hasn't been diagnosed yet or something like that. So I don't put this here to cause stress to anyone. Malnutrition is what we really want to prevent, and it includes all the risks of underweight itself, but also decreased immune function, poor wound healing, decreased organ function, the heart's, kidneys, and gut, worsening of other health conditions, mood changes. You can be depressed, or you can also have difficulty thinking through things, and decreased quality of life. There are a lot of people with Williams syndrome who are underweight but not malnourished, and that's a really important distinction, I think. Then if we look on the other end, obesity is associated with a lot of different health risks. You can have endocrine problems related to having obesity. It increases the risk of heart disease. It also can decrease immune function. It increases the risk of some cancers. It can affect kidney function. It can also affect, it can cause pain in the joints or problems with joints or moving. It can be linked to abnormal periods or decreased fertility, sometimes skin problems, some digestive problems, some respiratory problems, and it also can be associated with depression or with poorer thinking. Not everybody who has obesity has any of these things. So again, we care about obesity if it's causing these things. If it's not causing these things, it's not my job to make somebody a different size than they want to be, right? So again, we just want to focus on the health risks. You'll hear the term body composition from a lot of doctors, and that's how much muscle and fat someone has and where is the fat especially. That's really important to health, and it's actually more important than how much someone weighs. So the number when you step on the scale is way less important than how much muscle you have, which is great, and how much fat you have, which can be detrimental, but it also depends on where it's located, as we'll talk about. So if somebody has reduced muscle mass, so either somebody with underweight or normal weight or overweight or obesity, it's associated with reduced physical strength and function. As we mentioned, reduced bone strength. It also, your muscle helps kind of use the sugar we eat. So if you have lower muscle mass, it's often associated with higher blood sugar. And there are studies in older adults, middle-aged and beyond, that the lower muscle mass you kind of enter mid-adulthood with, the higher your risk of having health problems and eventually mortality in middle age and beyond. So all of us, this is not specific to Williams syndrome, all of us need to be thinking about our muscle mass, doing strength training, doing what we can to keep our muscle mass. There's a term I also just wanted to put out here that's called sarcopenia. And that's typically a term used to describe the loss of muscle mass with aging. Sarco is for muscle and penia means not enough. So basically not enough muscle. And this does occur in older adults, and it can occur across the body weight spectrum. So a big thing in medicine right now is people are talking about obesity and sarcopenia at the same time. So people who have obesity, but also they don't have enough muscle mass. So again, the takeaway from this slide is just that regardless of your size, your muscle mass is really important, and we should do what we can to keep our muscle mass and build it up. It also matters where your fat mass is located. This is someone's belly. This is like the front of the belly. This is the muscle that's along our belly. This is the fat you can pinch. And so it's called, it's called subcutaneous fat. And this is fat inside around your organs, and it's called visceral fat. And so sometimes you'll notice people have big bellies, but there's not a lot of pinchable fat. So those people sometimes have a lot of visceral fat. Visceral fat is associated with increased cardiovascular disease, diabetes, fatty liver disease, and inflammation. So your visceral fat tends to be much worse for you than having subcutaneous fat. And subcutaneous fat in the belly is not great, but actually the more subcutaneous fat you have in your legs and buttocks has actually shown to be protective against cardiovascular disease, type 2 diabetes, and stroke. So fat is not all bad. So especially fat in the kind of lower body can protect against some of the health risks that we worry about. And so when we talk about obesity, it's really the increased fat mass that we're most worried about. And this is so true that you guys have all probably been to your doctors and heard about BMI or body mass index, and people may have talked to you about your BMI being too high or too low. This is a group of experts who got together, and in January of this year, they published this new recommendation. And what they recommended is that we should stop using BMI to define obesity. Instead, we should think about how much fat mass someone has and how their health is. And doctors are slow, as you guys know, in many different respects and along many different axes, and I apologize on our behalf. What we should be doing when you come to the doctor now, and this may take a while to get implemented, is we should measure around your waist. Because remember I said that visceral fat is bad for you. And the bigger someone's waist is, probably the more visceral fat they have. So we can't measure visceral fat directly right now in the clinic, but we can measure somebody's waist. Your hip, remember I said kind of the fat in your butt is good for you. And so if you measure the hips and then you take how big is someone's waist versus how big are their hips, the higher that number is actually increases your risk of cardiovascular disease and metabolic issues. And the lower that number is, the better. Another measure that people are using, which just requires measuring the waist and not the hips, is the waist to height ratio. So these guidelines put into place, and many of your doctors may not even be familiar with this yet, because again, it just came out and we are slow. But we should be measuring these things and talking more about this than someone's BMI. Let's say you have a high waist circumference or you have a high waist to hip ratio that means one of these thresholds, but you're completely healthy. Then this recommendation is that your doctor should talk to you about preclinical obesity. So you probably have a little bit of extra body fat, and that's associated with a variable level of health risk going forward, but you don't have any illness right now. So, you don't have any evidence that your organs aren't functioning because you have extra body fat. You don't have any evidence that you can't go run if you want to, or walk up the stairs, or do whatever you need to do to take care of your kids or parents or grandparents or grandchildren. And you may be probably still at a higher risk of developing some diseases. So if you can get a little bit less body fat, that would be great. But you don't have clinical obesity because your body is working well. If you have one of these measures of extra fat and you have a problem with how your body's working, so either it's hard for you to do stuff that you need to do throughout the day, or your knees are hurting when you get up, or you're having maybe a little problem with your kidneys or your blood pressure or your cholesterol, then you have what's called clinical obesity. And again, this is totally separated from BMI. So that's the idea here, is that we want to, again, just focus on the risks that obesity can cause. So now I want to talk about approaches to underweight and approaches to overweight. But are there any questions not about specific people, like not about your specific patient situation, but any questions about anything that I just said more generally? Yes, you are.
You go backwards?
Yes.
So people with Williams are short.
Yes. Yes.
And then we don't know what effect lymphedema is on cardiovascular.
Okay, great. Two terrific points, as usual, by Dr. Cover. So people with Williams syndrome tend to be shorter than the general population. Body mass index is a tool that is unkind to those of us who are shorter, okay? Because the way you calculate your body mass index is you take your weight and you divide it by your height, and then you divide it by your height again. So height is in there twice. So those of us who are smaller, it's not that BMI is wrong, but it is that BMI is kind of partly dependent on how tall you are. And if you're smaller, your BMI may tend to be higher just because of being smaller in those population curves. I don't know about waist to height ratio. This would be a great thing for us to look at, actually, and use DEXA scans and see. Yeah. So I don't know about using waist to height ratio in Williams syndrome. Obviously, these cutoffs that I'm showing here are specific to kind of the whole population, and they're not specific to Williams syndrome. So thanks again for helping me make that point. It could be that we need specific cutoffs in Williams syndrome. We probably don't have enough data for that right now. But I would think that both of these could be used right now as pretty good measures of extra fat. And again, will probably be better than BMI. The second point was, what if you have lipedema? And again, lipedema will probably increase your BMI, and it is definitely kind of increased fat, but we don't know if lipedema increases your risk of having heart disease the same way that having that fat somewhere else, like in your belly or especially around your organs, would increase your risk of heart disease. So you can imagine two people with the same BMI, one of them has lipedema and the other one has a lot of fat in their belly. Actually, the person with fat in their belly may be worse off, but we don't know that. So does that answer or make the points we should make? Okay, great. Thank you. Okay, so again, let's say you're eating really well, you're eating healthily, but you have underweight. What do we need to do about it? So the approach, there's two important goals. The first one is to make sure that someone is eating well. And that typically involves a multidisciplinary team. So it typically involves a gastroenterologist, like Dr. Zarkessler, Dr. Feichner, who talked earlier today. It involves a registered dietitian, also sometimes known as nutritionist, but nutritionists don't always have as much training as somebody who has RD after their name. Speech language pathologist, occupational therapist, behavioral specialists, and behavioral specialists, a big umbrella that can include psychologists and psychiatrists. If nutrition is sufficient with whole foods, that's fantastic. And that's the best way. I'm going to rant about not whole foods later. But if you're getting enough with whole foods, that's fantastic. If you need nutritional supplementation, and especially some kids with Williams syndrome and some adults with Williams syndrome as well, may need nutritional supplementations with things like shakes. That's not my area of expertise. And thankfully, we had some talks about that earlier today. The other really important thing is something wrong, and that's why I'm underweight. So in younger kids with Williams syndrome, they can have problems with suck and swallow, or with eating or chewing, celiac disease, other gastrointestinal diseases, like you heard Dr. Zart Kessler talk about, ARFID, like you heard in the session right before lunch, the avoidant restrictive food intake disorder, other chronic illnesses, or medication side effects. So you want to really think about, is there anything causing this person to be underweight and not healthy? If a person is underweight and healthy, you may not have anything to worry about. You just want to do your best to keep as much weight as you can, and to be active, and again, exercise to make sure you're having lots of muscle mass and keeping your bones strong. In terms of interventions for underweight, this really depends on the diagnosis. Again, if you're a healthy person who happens to be underweight, then you may not need any intervention as long as you have enough weight and can keep that weight. If you're found to have a diagnosis, the primary care doctor is a great place to start. Multidisciplinary feeding and nutrition team, treating any underlying conditions, and addressing anxiety or psychiatric comorbidities is also really, really important. I think I have been coming to Williams syndrome events for a long time now, thanks to Dr. Kober. And when she talked about ARFID this morning, I was like, oh, duh, like I should have thought about that before. So it's really important to think about why someone with Williams syndrome who's underweight is not eating enough, if they aren't eating enough. And that could be best addressed in the mental health realm. Again, if you need to supplement, ideally whole or real foods. So you bought the real ingredients at the grocery store or on the edges of the grocery store and you made a cake, that's much better than a cake that you buy. If you made your own hamburger from, again, stuff from the grocery store, it's much better than a hamburger you get from a fast food restaurant. Some people may need high calorie formulas or shakes, and this is individualized. They all have different stuff in them and they can be better or worse for different people. So it's really important to consult a registered dietitian. And in both cases, you do want to monitor really regularly. Sometimes nutritional shakes have a lot of calories in them and you can overshoot your goal. So it's important to have regular weights and regular monitoring. And another thing, as an endocrinologist who worries a lot about bones and vitamin D and calcium, I don't think that anybody with Williams syndrome should limit calcium or other food types unless it's specifically indicated. One of our talks earlier today was talking about how reducing dairy may help with constipation. And if it does, that's one thing. And then we should talk about how to get enough calcium and vitamin D. But nobody should just be like, well, the doctor said maybe I should limit dairy, so I'm not going to do dairy, right? So only if that's specific to your situation. Now I'm going to move to overweight, and I have, just to be transparent, I have more expertise here, both personally and professionally, and so this part is a little bit longer. So I have a lot of opinions about what not to do, and the first thing is really no shame and no blame. So, 10 years ago, I think we were in this situation where people with obesity were seen as not having enough willpower and they just can't keep themselves from eating at night. And then now we have these injections, which I'll talk about, that for some of us magically, like, we stop being hungry. What that teaches us is that it was not willpower in the first place, right? So a lot of obesity is a brain issue, and it's not because somebody's not trying hard enough. Also, for all of us, the more challenging our lives are, the harder it is to handle weight issues. So we really need to take all the kind of you should, you shouldn't out of this as much as we can. Another thing I think is really important is that strict diets almost always backfire. That's true in everyone. And over focus on using the word exercise. You'll notice hopefully throughout the rest of the talk, I will not use the word exercise. I'm going to use the word physical activity because exercise sounds like going to the dentist, or sorry, a dentist is speaking after me. Dentists are wonderful. Exercise sounds like something you don't want to do, right? Physical activity should be fun. Weight loss from strict dieting is rarely sustainable. So a lot of people, we all watch The Biggest Loser and those people lost a lot of weight. Most of them gained that weight back. You really need to focus on kind of sustainable lifestyle habits. If people come into my clinic and start talking about dieting, automatically I can see like the parent is feeling one way and the person with Williams syndrome is feeling shameful and guilty and upset and doesn't want to talk about it. And really there's no benefit to that, right? So we're not actually helping the situation. And again, I thought of this and I'm proud of it. Exercise takes the fun out of function, right? So we want to be doing physical activity, not focusing on like this thing that you have to do. So activity is the most important thing. If people ask me the number one reason why they should do physical activity, it's because it's good for your mental health. Okay, it gets you outside. Movement helps your mental health. It helps you feel good about yourself. Ideally, especially if someone has Williams syndrome and likes being social, you can do it with other people. You can spend time in the sunshine, get your vitamin D, have some nice social time. It builds muscle mass, it improves bone strength, it helps with blood sugar control, and it honestly reduces the risk of so many other diseases. Like if exercise was a pill, we would all be paying so much money. It's an amazing drug. Exercise is really the best thing that any of us can do for our health. And I'm standing here, so I don't like sorry, I just used the word exercise and I don't actually like exercising, but physical activity is something we all really need to focus on because it really is the best thing we can do for our health. The benefits are insane, actually, like every single piece of your health. It's much easier to keep physical abilities than to get them back after they're lost. So as all of us, including people with Williams syndrome, age into adulthood, we need to keep running, keep walking, keep lifting heavy things, keep doing everything that our bodies can do and celebrating what our bodies can do. Because once we've lost those things, it's harder to get it back than it is to keep them in the first place. So how much and what kind of activity? So the recommendation for people with Williams syndrome is to have daily physical activity, 20 to 60 minutes a day. The kind of general population recommendations focus on moderate to vigorous physical activity. And I actually think that for the general population, we might be shooting ourselves in the foot. I love this, right? So just be doing something at least 20 to 60 minutes a day. They should be age appropriate, enjoyable activities with somebody else if you like that, dancing, walking outside, being at work. A lot of people work, on their feet and that counts. I did want to mention that some people obviously have cardiovascular issues, so involve the cardiologist when you're thinking about this. And any movement is better than sitting still. So if you're walking around your apartment, putting things up, or if you're cooking and you're standing while you're cooking and chopping and peeling, it's much better than sitting on the couch and watching TV. Okay. And we want to start small and start comfortably. So when you do something, make sure that you enjoy it so that you want to do it again, right? And focus on what's sustainable. And for adults, I think kids we all need to do weight bearing. I think kids do weight bearing naturally as they kind of run around and are all over. For adults, we don't do a lot of weight bearing necessarily unless we purposefully do it. So when possible, try to get strength in there. Walking is weight bearing. Weightlifting is weight bearing, doing kind of push-ups or sit-ups, or I guess sit-ups are not weight bearing, but push-ups are. The only thing that's really not weight bearing is swimming. It's wonderful for you in many different ways. So people should swim. But if the main activity is swimming, they also need to be walking and thinking about using your arms as well. So what about nutrition? So again, I think it's really important to focus on adding things or replacing things instead of taking things away, because that feels like a deprivation, right? And it feels punitive. So first, if there are gastrointestinal issues, talk with a gastroenterologist. You heard earlier, I think it was Dr. Czar Kessler, who said some fiber is great, but too much fiber can be problematic, right? So if there are issues, kind of working with a gastroenterologist is really important. Okay, here comes my rant on real foods. Our bodies have evolved over tens of thousands of years to eat real foods that grow from the earth, or that are, if those of you who eat meat, that are on the earth. So our metabolism is like specialized for that. Our brains are specialized to know that we've eaten enough cauliflower and steak now, and now we're full. All of this is a beautifully evolved machine that has evolved to eat whole foods. When you buy processed foods from the middle of the grocery store, they override a lot of our biological processes. So you don't feel full in the same way. They actually are not metabolized the same way. So the reason people rave about high fructose corn syrup is because our bodies didn't evolve to metabolize it, and it gets made straight into fat in our liver. We're not supposed to be eating that stuff because it doesn't naturally grow in the earth. And really importantly, I'm going to sound a little bit like a conspiracy theorist, but there's kind of 5 major global food companies, and they engineer food so that we don't want to stop eating it. Right. So really, when you're buying like boxed food from the supermarket, it's much easier to develop obesity. So whenever you can, please eat whole, real foods. That includes fruits and vegetables, fiber, and whole grains. Try to avoid sugary drinks. So this can be hard. It can be especially hard when you're underweight as a child and you drink a lot of juice to try to be less underweight, and then you become an adult and all of a sudden you need to stop drinking juice. Try to replace with seltzer or other low-calorie beverages that people like. And regular soda is pretty hard to quit once you get a habit, so try not to start in the first place. And again, related to the talk that you had before lunch, really try to engage a behavioral specialist as well as a nutritionist, because for all of us, so much of our eating behavior and our eating drive comes from our brain. So it's important to think about kind of habits and behavior and emotions around eating as well. Sorry, I just realized I should look at the time. Okay, good. So this is another. Yeah, okay. This is another graph from the SHAPE study. And the message that I want to give on this slide, I'll talk about the graph in a second, is that really trying to prevent or minimize weight gain is really important, kind of starting around adolescence. Because again, most people with Williams syndrome will be relatively thin, and most don't have overweight or obesity in their childhood years, but then it can really develop starting in adolescence. And so it's good to anticipate, and it's good to kind of think about that and put some interventions in place. So these data, again, are from the SHAPE study with Dr. Pober and Danielle and a lot of other researchers at Mass General and elsewhere. And what you see here is that they divided people with Williams syndrome into 2 different groups. And so we had like weights across people's lifespan. And the groups were people who don't gain a lot of weight, people who do gain a lot of weight, and people who kind of are a little bit all over the place and we can't characterize very well. Those guys are on this graph. So for example, what you're seeing, this is an individual with Williams syndrome who gained a little weight and then lost some weight, right? Or here gained a little weight and then stayed steady. So these people were too hard to classify into groups. An important message here is you can see that the high gain group, it didn't necessarily start out with a lot of extra body weight. It's just a really vulnerable time, especially down here in the kind of teen years when people are moving out to different places, but also can be vulnerable throughout the lifespan to have a high weight gain, whereas other people just tend to kind of stay stable. Even if they start high and stay high, that's okay. We want to just really try not to have a lot of weight gain if we can. And again, the best way to prevent that is as much physical activity as possible. So now I'm going to talk about medications for weight management. The first thing to say, which Dr. Pober already said this morning, is none of these have specific data that are published in Williams syndrome. We are using some of them in Williams syndrome, and we all have anecdotal experience. I've talked to some of you today about your loved one with Williams syndrome, and getting all that data is really helpful. And I hope that one day we can put it all together and kind of scientifically analyze it. But right now, everything I'm going to tell you is from experience and not from things that are written in the literature. We do have a lot of data on these medications from the general population, so I am using that plus experience. The first drug is metformin. I have slides on each of the drugs in purple there. Metformin is very safe. We've been using it forever, and it's sometimes effective. If you've seen me as a patient, I might have asked you to start it. Some of you are on it. And I think it's a great drug, but it may not make a huge difference in weight. The GLP-1 receptor agonists are the kind of miracle injections that are out now. And I use the word miracle a little bit sarcastically. I don't really mean that they're miracles, and they are definitely not miracles for everyone, but some people, they help and can really be effective with weight loss, but they do have some side effects. There's another class of inhibitors called SGLT2 inhibitors that I'll talk about. There are other medications that are approved for obesity in the general population that I don't have experience using in Williams syndrome, and they have some side effects that I probably would be hesitant to use them. So the first one is a combination of phentermine topiramate that can raise blood pressure and raise heart rate. And topiramate can make people kind of mentally cloudy. Wellbutrin naltrexone is another one, and then other stimulants used off-label. So I'm not going to talk any more about those drugs. So metformin we've known about the compound metformin for a long time, and it was first used for diabetes in the 1950s. So we have decades of experience on metformin. It's very, very safe. It lowers blood sugar, and it also has a lot of pretty modest benefits. So it slightly decreases the risk of a lot of cancers. It slightly decreases the risk of certain types of heart disease, et cetera. So it does a lot of things a little bit, and it doesn't do anything really bad for you, except if you have side effects, which I'll talk about. Metformin's an oral medication. There's a regular formulation and an extended release formulation. The regular is taken twice a day, and extended release is once a day. In diabetes, you typically get up to 2,000 milligrams, either 1,000 twice a day or 2,000 once a day. If I'm using it in Williams syndrome and the person doesn't have diabetes, I typically will only do about 500 or 1,000. So what can happen when you're on metformin? Some people have nausea or abdominal pain or bloating or diarrhea, and that can be pretty tough to handle. So some people have to stop metformin because of that. We also have to be cautious if someone has kidney disease, just to make sure that they're doing okay and not increase the dose too much. But otherwise, generally, it's, as I said, very safe medication. It can sometimes help with a little weight loss, and I find that even more often, it seems to help with weight maintenance. The glucagon-like peptide 1 receptor agonists. So these were also developed as medications for type 2 diabetes. GLP-1 is a protein that's produced in your gut when you eat foods, and its job is to go all over your body and tell other parts of your body that you just ate. So it tells your brain, like, I'm eating, get full. It tells your pancreas, I'm eating, let's release some insulin. It tells your liver, I'm eating, let's kind of change our metabolic protein so we can store that food instead of making sugar. So it does a lot of different things that are good for our metabolism. And while people were using it for type 2 diabetes, they learned that it turns out to cause weight loss. And at higher doses than used in diabetes, it actually can produce a lot of weight loss. The most effective formulations right now, so there are daily formulations, there's daily pills, and there are 2 weekly formulations that are the most effective. Semaglutide, which is also called either Wegovy or Saxenda. Saxenda is the wrong word. Why am I? Ozempic. Thank you. So that's semaglutide. That's a once weekly injection. Typically, there is an oral formulation that's for diabetes. It's approved for diabetes only. I'm trying it in one person, but there's not data in Williams syndrome for any of these really, except anecdotal. There's another drug called tirzepatide. Tirzepatide is newer than semaglutide, and it has that the GLP-1 hormone. And it also has a hormone called GIP. So it actually does 2 different things. GIP is another hormone released by your gut when you eat. So it probably is a little stronger. It looks a little stronger in terms of the weight loss it achieves. And it also looks like it's tolerated a little better in the big studies. That said, every individual will be different. Tirzepatide is either Zepbound or Mounjaro. So those are the brand names that you're going to know tirzepatide under. Again, that's a weekly injection. About 10% of people will have a side effect that makes it really hard for them to stay on these medications as well. In almost everyone, they cause at least a little bit of nausea. They may cause some vomiting. They may cause diarrhea or constipation. Nausea is really the most common thing, and only a small percentage of people will have those other issues. Much less likely, you can be allergic to it. It can cause dizziness or headache. And there's some other very rare things that a doctor would ask you about and talk to you about before you started it. These have a lot of different effects, so they help blood sugar. And one of the main effects is that they really do kind of act on your brain to decrease appetite. And we're still learning exactly how that works, but they do that. In my opinion, so anytime you're prescribed one of these, you're going to be started on the lowest dose. You'll take that dose for at least 1 week and make sure you tolerate it. And then you'll increase up, for at least 1 month. And then you'll increase up to the next highest dose. In my opinion, people should stay on whatever is the lowest dose that works for them. So if you're on 0.5 of Wegovy and you're doing great and you don't need to lose any more weight and you're feeling perfect, there's no need to go up. Whereas if you're on 0.5 and it's kind of stopped working or it's not having the effects you want, then you can go up. So people's doctors will work with them. The reason I say that is because if you read the label, it would just tell you to go up without asking every month. And I think it's better to kind of tailor it individually. Very briefly, this other type of drug, which is called SGLT2 inhibitors, you will know those from Super Bowl commercials like Jardiance or Invokana or Farxiga. These are also diabetes drugs. What they do is that they block a channel in your kidney that helps you resorb sugar back into your body. So kidney will go into kind of the urine you're making, or sorry, sugar will go into the urine you're making. And then you have channels to get it back into your body, into your bloodstream. And this blocks those channels. So you pee out more sugar than you usually would. Generally speaking, we don't pee out sugar unless our blood sugar is abnormal, but this medication would change that. Because of that, it lowers your blood sugar, and it can have a modest effect on weight loss. I put it in because Dr. Pober and I have talked about potentially using this in some people with Williams syndrome. And I don't know that I actually have, but this is a possibility because it's a daily pill and it has a pretty good side effect profile. It makes you pee more often and it can cause some dehydration, but typically it's really well tolerated. Because there's more sugar in the pee, it can cause yeast infections or urinary tract infections. And one important thing to say for both of these medications is that at like a population level, they've been shown to be really good for heart health and for kidney health. So we are thinking about them in terms of weight loss, but they probably have good long-term effects on other parts of health, and all of that is still being studied. Okay, so I just want to end by us all remembering again the importance of physical activity for people of all shapes. So we want to build our muscle mass, we want to keep our bones strong, and I'll also just add we want to try to eat as much real food as possible and as little processed food as possible. And that's because that helps your whole system work, like in knowing you're full and in metabolizing things the right way. And so what are some of the things that physical activity does that's totally unrelated to me as an endocrinologist? So as I mentioned, it gives you stronger bones and muscles, but it also increases your energy. You sleep better when you exercise, your mental health is better, your immune system works better, and you reduce the risk of a lot of diseases down the line. So all of us should be doing this as much as we can. Thanks very much, and happy to take questions. Yes. Okay. The question was about a supplement called DCI 500. And I'm sorry for a disappointing answer that I don't know anything about it. But thanks for asking and I'll look it up. Yeah. Yes.
You talk about the muscle mass and what you did for patients that have Williams syndrome. I'm wondering how you balance the technology they use the detail on how to extend their long term.
Yes. Yes. So this question is about, so on GLP-1 receptor agonists, the injectable medications for weight loss, some people lose a lot of weight. And typically when that happens, they also lose a lot of muscle mass. So it's something the whole field of weight loss and obesity medicine is talking a lot about. And the question was about how do you balance that in Williams syndrome when they already, and I didn't, Dr. Poper brought this up a little bit. We did a study in Williams syndrome where we showed that on average, people with Williams tend to have a little bit less muscle mass and a little bit more fat mass, kind of on average compared to people without Williams syndrome. So it's really important, especially if someone is on one of those medications, to have regular physical activity and make sure that the person's doing regular physical activity. I think that's the most important message. So my personal experience with the GLP-1 receptor agonists in Williams syndrome is that some people don't tolerate them well. For some people, they don't work well, but for other people, they can work really well. I just talked to someone in the hallway for whom like the food noise has gone away. And you know, if you watch the Oprah special or other things on TV, it can really decrease how much you think about food. So that can happen in people with Williams syndrome, but doesn't always work that way. In my opinion, it's always an individualized approach. It's really important to eat enough protein if you're on those medications, and it's really important to exercise enough if you're on those medications. Great question. Yes.
How is brain health impacted when someone with Williams syndrome is lowering weight and malnourished, and how can we help them when they're already on protein shakes that are high in calories?
Right. And it was brain health is what you said, right? Yeah. So we actually don't know the mechanisms by which being malnourished affects your brain health, both like your mood. I don't know if Dr. Tom or anyone else wants to comment, but we know that people who are malnourished can have worse mood and also can have worse, what we call cognitive function, basically your ability to think. The best way to address that is to do what you already said, which is maximize whole foods as much as possible. And then if that's not enough, maximize supplements in conjunction with a registered dietitian. And beyond that, I think because we don't know the mechanisms, I don't know the answer to your question. Sorry. It's a great question though. Yes.
Is it true, like with the GLP-1s, that once they lose weight, that you still have to maintain staying on it?
Yeah, okay, that's a great question as well. And it was the data on the GLP-1 receptor agonist medications is that if you lose weight on them, you have to stay on them. And if you come off, you will gain the weight back. I don't have much experience in Williams syndrome specifically. In the general population, that is generally true. Unfortunately, insurance is covering these medications less and less because a lot of us qualify for them and they're very expensive right now. So there's a lot of active research looking into like, could we just reduce the dose, or could we switch to another oral obesity med that might be cheaper but still work? Like, could we switch to some other way to maintain the weight? We need more research there. Yeah, great question. Thank you all so much. Pleasure to be here.
Thank you so much, Dr. Stanley, for that great talk. Next, we have Dr. Jen McGee. She is the Chief of Mass General Division of Dentistry. She is wonderfully dedicated to improving access to dental care for underserved populations, and her practice focuses on medically complex adults and pediatric patients, trauma survivors, and those with special needs. And I know that she rushed here straight from clinic, so thank you so much, Jen.
Great. Thank you all so much. I'm so happy to be here to talk to you, and I see a lot of friends in the audience. So let's see. All right. Excellent. All right. So today I'm going to talk to you about oral health. This is my agenda. I'm going to tell you a little bit about myself. I'm going to talk about some of the issues that we commonly see with Williams syndrome in dentistry, just like an overview. And then we're going to talk about typical dental health things. And then we'll go back to focus more on the Williams syndrome. So I think it helps to think about it in a broader things that we think about all of our oral health. So I think it's important to go over those issues, things that burning questions about your own mouth that you may have never had the answer to. And then some tips and tricks. Let's see. Okay, so a little bit about me. I work at Mass General. I've been here since 2007. I love working at Mass General because I think it provides the opportunity to provide really comprehensive care to our patients and see them throughout their lifetime. They have a wonderful disability program that can help to really customize care. And I always think it's amazing to think of such a big place with so many protocols and very specific things can really focus down and cater care so that people that might need some accommodations can really get and access care the same way as anyone else does. This is our office let's see, can you see? Yeah. So we have our outpatient clinic. It looks, just like any other dental office anywhere. And then for those patients that really have a very hard time tolerating care for whatever reason in the clinic, sometimes we have the option of taking them to the operating room and doing the care under general anesthesia. This is my nephew. No child was harmed in this. So sometimes despite our best efforts to provide a safe and comfortable experience, I think when kids are real little, they will show you how they're feeling. Adults sometimes will hold that inside, but I think a lot of us have this thought of being at the dentist and it causing some anxiety. This is Colton now. Look at how happy he is. So everybody, we can turn around eventually. So this is what it looks like. You know, when you're in the dental office, there's a lot of like smells and sounds and things that might seem really uncomfortable and scary. So I think it's important that you feel that you're with somebody who will take the time to stop and ask you and answer any questions that you might have. And, you know, sometimes if you think any of these instruments look like they are, you know, might be something you need to worry about, it's always okay to ask us so we can let you know. Another favorite thing I have about working at Mass General is my wonderful team. This is our team. We were doing a walk for the Cancer Center at the North Shore. And this is us here. And they're just wonderful, compassionate people that make what we do every day possible. The other thing I love about working at Mass General is that we have the same health medical record as the rest of the MGB system. So it's really easy to communicate with your doctors, to talk about things that we might be worried about, and to see how you're doing in other aspects of your health. And then we have the patient gateway option. So for me, I find it's really nice for my patients, if they have a concern, they can just reach out pretty easily to me through that. And then another thing about me, I would not be complete without talking about my kids. So this is Charlotte, she just turned 14. This is Connor, he just turned 12. And the big news in my house today is they both got parts in the school play at the middle school. They found out this morning, so yay, yeah. So Charlotte has an acting role, that's what she wanted to do, and Connor is gonna be behind the scenes doing lighting for it. So they're both very excited. All right, so let's look at, so I'll just talk about these very briefly and then we'll go into we'll come back to these at the end. But in Williams syndrome, we know there's a wide range of things that can present in the mouth that may be a concern for your dentist. So the shape of teeth can be different. Sometimes they describe them as like shovel-like, or they can be smaller. You can have crowding of your teeth. There can be missing teeth. Our fancy word for that's hypodontia. Your diet can be a bit different, and that can cause problems with your teeth. People that have gastric reflux will see problems with their teeth. Your decrease in muscle tone and coordination might make it hard to brush. Attention issues may make it hard to either remember or to stay focused while you're doing the brushing. Sometimes with sleep dysregulation, if you're up late at night or maybe snacking, or like sort of finding a time where the normal like brushing and home care before bedtime might be tough. Anxiety can definitely be a problem, especially around new or unfamiliar circumstances or in the medical environment. And then sometimes the joint laxity, so like problems with your joint, can cause problems with the TMJ and the joint that's there. So we will first, just like I said, take a step back and sort of talk about all these things in general. And then I think it helps to make it make sense how they might apply to Williams syndrome. So first of all, like, why are teeth important? I think we like all sort of know, but the big things they do is, so there's the look of it, the smiling. There's my daughter a long time ago. So our teeth are important to show people, you know, we're happy to smile at them. They're really important in eating. Like we just heard a lot about like how important good foods are. So if you don't have healthy teeth, it's really hard to eat all those whole foods. They're important in speaking and the way that we form our words. Baby teeth play a really important role in holding space for our adult teeth so they can come in the expected positions. And then I always like to say, well, all these things that teeth are very important for, one thing they are not good for is tools. Teeth are not tools. So do not open bags with them. Don't be using them to tear into things. It's really easy to break teeth by doing that. For dentists, one of the big things that we look at around the health body connection was a Surgeon General report back in 2000, and they talked about how important oral health is to the rest of your body. So because of insurance issues, way back when, they really separated the mouth from the rest of the body, but we all know that so many things in our mouth connect to the rest of our body, and it's really like a fake thing to act like it's not as important as the rest of your health care. And really, we know that you just can't be healthy unless you have good oral health as well. So this is a busy slide. There's a lot of things here, but these are just to show some of the many ways that we know your oral health is connected to your overall health. So, we have things like lung disease, heart disease, diabetes, all those things impact the rest of your body, and they impact your mouth as well. So, and this again really goes back to like why I love being at Mass General, because we're looking at you in all aspects of your overall health. So unless we are considering your oral health as part of the rest of your health, then you're really missing like a big part of keeping yourself healthy. All right, so now back to the teeth. So this is my niece, she's now 16, but this shows, so everybody has primary dentition, we call it. So it's the baby teeth that come in. They start coming in when you're about 6 months old. You start to lose them when you're about 6 years old. And as they come in, we can see these are sort of the order. If you think back to those cute little babies, you see they usually get those lower front ones first and then the top ones. And they come in an order that's pretty typical. And then when you're about like 6 years old or so, you start to lose them in the exact same order. So those lower ones will start to get loose and then will pop out. But as they're coming in, they're doing an important job. So they're holding the space for the adult teeth that need to come in. And you can see this is a picture, it's sort of complicated. So these are all the baby teeth that are there. And then as those baby teeth are in your mouth, there's lots of other things that are going on in your jaw. You've got your adult teeth that are forming and starting to come in. So if you have what we call malocclusion, which we often see in Williams syndrome, where maybe one jaw is smaller than the other, or both jaws are small, you can see that even at this early stage, you start to have a lot of issues with maybe spacing, with crowding. You might not have enough space for the adult teeth to come in where we expect them to. And this was my sister from a long time ago. So then as you get into, 6, 7, 8, and then the teen years, you start to have what we call mixed dentition, which is where you have a mixture of baby teeth and adult teeth. And then all these adult teeth continue to come in. So this is, the kids around 8 or so often have that adorable look with teeth of, we call it the jack-o'-lantern look sometimes, teeth of all different sizes because they have a mix of all those teeth. And this is really where we start to see a lot of that malocclusion. So if there's a mismatch between the size of your jaws and the space of the teeth that are coming in, or the teeth are coming in crooked, we can see lots of different ways that the teeth don't align as we may want them to. And that can be problematic in a lot of ways. So like we talked about in the beginning, teeth are important for the way we speak. They're important for the way we eat. And then also the teeth that we have and where they sit in your mouth and the shape of those teeth are really important for different functions. And you can kind of think about it as the way you might eat your lunch. Those front teeth are a bit sharper, they're narrower, they're good for tearing into food. The back teeth are really good for grinding the food and making it so it's easier to swallow. So if you are missing any of those teeth or they're in the wrong position, it might make it really hard to eat all those healthy foods that we'd like you to. All right, so this is a tooth. The tooth is covered by, so this is like if we're looking at a tooth like from the side, so we're sort of like cutting into it. So there's typically the crown of the tooth, which is a part that sits above the gums, and then the root of the tooth that sits below the gums. They all have blood vessels that attach to it. There's also a nerve in the tooth. There's enamel on the outside of the tooth that has no nerve endings in it. It's a very hard substance. And then on the middle part of the tooth is dentin. Sometimes if you break a tooth or you have wear of the teeth and you have some of this dentin exposed, it can be very sensitive. And then the deepest part is the pulp or the nerve of the tooth. So when we think about these teeth, one of the things that comes up a lot in dentistry is what causes a cavity and how do we prevent it? So really what you need for a cavity is you need to have a tooth, you need to have bacteria that are in our mouths that cause cavities, and then you need complex carbohydrates, so like types of sugars in your food. And when you have all those things together, it will lead to a cavity. So when we are thinking about it, like cavities in general, I think of it oftentimes as like a seesaw or like balances, and you're trying to balance the things that cause cavities against the things that help prevent cavities. So things we know that prevent cavities are things like good home care to remove the sugars, fluoride in your toothpaste or in your water, having enough saliva. And then things that make it more likely to get cavities are, if you people that are exposing their teeth to more sugar. So having like a little bit of food over a lot of time, the bacteria love that. Having a dry mouth where there's not saliva to help clean the teeth. Having an environment that's like a little bit more acidic. So all those things can make it a little bit more likely to form cavities. So we always are trying to figure out how do we make it so that somebody is less likely to form cavities. And then I like this, I have it hanging up on my wall in my office because it's a usual culprit. So these are particularly things that are these are foods that are like excellent at forming cavities. So there's things that are like a bit sticky that will stick to your teeth and just kind of stay there. They might be hard to clean off yourself without really brushing your teeth. A lollipop, my kid, I'm the worst about taking lollipops from my kids. I'm like, that's enough. You've had that for long enough, take it. But the bacteria in our mouth love lollipops because it's just a little bit of sugar over a long period of time. So they're not my favorite treat to have, or like hard candy. So things like this, if they have sugar in them, are going to be much more likely to cause cavities. So what is a cavity? So this is what it looks like this is like a little diagram of it. So it shows like the cavity forming there. The bacteria in our mouth take that sugar and they make like a little acid and it makes a little hole in your tooth. And this is what it looks like when I go looking for it. So sometimes the start of a cavity is like this chalky white color there, and then it will get like a darker color. It will feel sticky often. This is a tooth that has an old silver filling in it and has a few like little fracture lines, and that like shadow that's there, that's a cavity. So when we look at it here, this is what it looks like on the x-ray. So this is the enamel and the dentin, and you can see that it's just like a little darker, and that's from the acid from the bacteria causing that little hole. In the mouth, we can see cavities form in a few different spots. So they can form in the grooves of your teeth. That's really hard to prevent. Sometimes we do sealants to help with that. But otherwise, if the bacteria gets hold there, you can get it from the top. You can also get it in between the teeth, and that's where flossing comes in. Or sometimes if you end up losing a little bone and the root is exposed, you can get it on the root of the tooth. And that's always a bit tricky because those ones move the fastest of all of them because they don't have the enamel to slow it down. So here we see that, we start with the cavity. Over time, if it gets deeper, the bacteria gets into the nerve of the tooth and can really irritate it and then cause the root of the tooth to die. And that's when you need like a root canal on a tooth. And after that, the bacteria that's in there will cause a little abscess. So if you've ever had a tooth that needed a root canal, oftentimes if you bite down on the tooth or you push on it, it hurts. And that's because there's a little pocket of infection there that now that the tooth will kind of press into and cause a bit of pain. The other thing we think a lot about is gums. So your gums around your teeth, this is a healthy mouth. This is one with gingivitis. So if you are, when you're brushing, if you're missing the gums and you leave a little layer of the plaque there, it will irritate it and it will get the gums very puffy. Sometimes over time, it will get even more puffy. This is a picture of, it's got a big word, the pericornitis, but basically it's the gums. Oftentimes it's around a wisdom tooth, but sometimes we can see it around other molars where the gums just don't totally get out of the way as a tooth comes in. And it's very easy for food to get caught underneath there and cause a lot of inflammation. So a lot of times that irritation is why people end up needing to get their wisdom teeth out over time. It's just, you can see that would be impossible to keep clean. So like we talked about with the gums, they start to get a little bit red, just the puffiness in the gums themselves. It's called gingivitis. If that inflammation and the puffiness continues, it's going to affect the bone that's underneath it, and the bone will start to erode in response to it. And that causes what we call periodontitis, which is the bone loss around the tooth. That becomes really concerning as it gets worse and worse, because then the tooth doesn't have a good anchor, and the tooth can start to get loose. The other thing we can see a lot of is grinding. So this is somebody with very severe grinding. Over time, you can wear down the teeth. It's just the force of the upper and the lower jaw pushing together, but it can be very severe. Often associated with grinding is also TMJ issues. So the TMJ, the temporal mandibular joint, is right here, connects the jaw, the lower jaw, to the rest of your skull. And so what we have in these are some pictures that show, so the jaw sits in the upper one, and there's a little piece of cartilage, kind of like your knee, that sits on top of it. And that just will rotate back and forth as your jaw opens and closes. Over time, the little ligament that holds that in place can get stretched out. And then when you open, that piece of cartilage will sort of slide forward or back, and you'll hear it click or pop when it goes back and forth into place. Sometimes that's a problem, sometimes it's not. It depends a lot on if it's causing your jaw to shift from side to side, if it's causing pain, if it's causing other issues. So it's something we always look closely at when we see you, but that's why it's just that little piece of cartilage that's moving around that you can hear. The other thing associated with grinding that we see is the muscles playing. So basically, like all the muscles in your head that are responsible for holding your mouth closed or helping us chew. If you're grinding at night, those are running a marathon. You're working those muscles over time. They can be really sore and fatigued. And those are all things that we can see. So oftentimes people will have soreness of the teeth. They can have headaches. They can have migraines, all related to just grinding and clenching your teeth too much. Another thing we see with dental is bad breath, and that can be caused by a bunch of different things. Sometimes and often the most simple is just dehydration. So if like you're not drinking enough water, just to clear out your mouth, that can lead to bad breath. So we recommend a little bit more drinking of the water. It can be accumulation of the plaque, just like we saw with the gingivitis. If that plaque sits along the gum line, you can have dry mouth, which is different than dehydration, where you might have dry mouth because of a medication that you're taking. So there's just not enough saliva. Your diet, sometimes people just eat things that impact the smell of their breath a bit. Certainly if you're smoking, or other medical conditions, including sinus issues. So if you have like postnasal drip, especially around allergy time, you might be experiencing a little bit of the bad breath. Then I like to say a joke. So what do you call a bear without teeth? A gummy bear. All right. So the other part of dentistry is like, so you have these issues, like what do we do with them? So I think it's important to know like the options of treatment, and just so you have a better understanding of things that we might be doing in there. So this is what a filling looks like. So when we see a cavity, like we showed before, we clean out all the decay that's there. So that means like all the soft part of the tooth that's been changed because of the bacteria, and the bacteria that's there, we clean it out. And then we put in either a silver filling, which is called an amalgam filling, or more commonly a white filling, which is a resin or composite filling. And that's typically tooth colored. So that's what it looks like before and after. If you needed a root canal, what that is where it's similar to a filling where they go into the tooth, but they go all the way into the nerve of the tooth. They use special instruments that clean out the bacteria that's there, the blood vessels that are there in the nerve. They use a bleaching solution to get all that bacteria out, and then they fill it up with a material called gutta percha, which seals the bacteria out. And then once that happens in the tooth, that area is healthy again, the abscess will resolve and it won't be painful to bite down on the tooth anymore. A crown of the tooth, I always like laugh a little bit when I talk about this, because I started dental school in 2003, and that the internet was not quite what it is today. There's no chat GPT. And I remember sitting on my first day of dental school being like, I can't wait till they tell us what a crown is. So I feel like I need to share with people, because I don't know if people know if they haven't had one themselves. So a crown is basically replacing and protecting a tooth if you've had like a fracture of the tooth or a large cavity. The nickname for it is a cap, and that's really what it is. So we prepare the tooth in all directions around it, like a circle around it and off the top. And then the crown is made by a lab, made of like porcelain or other materials, and it goes right over the top of the tooth to help seal and protect it. We also have ways of replacing teeth if people lose teeth. So one way is a bridge, and a bridge is something that we glue in, and it replaces one tooth by putting a crown on either side with a fake tooth in the middle. We also can do dental implants, which is a titanium screw that goes into that spot where the tooth is missing, and then we put a crown on top of that. This is just comparing what like a natural tooth would look like to the parts that the implant is replacing. Sometimes we do partial dentures, so that's something that you take out at night, and that replaces any missing teeth when you don't have all your teeth missing. Or if all the teeth are missing, we replace them with complete dentures, and that's what they look like when they're in, and that's what they look like sitting, you know, on the table. And in anything that's removable, like that, complete dentures or partial dentures, it's always really important that you take them out at night to give your tissues a chance to relax and not have it sitting on them all the time. For people that are grinding, we have occlusal guards, which are night guards. So this basically, the job of that is to separate the top and the lower teeth, so you can't really get that same force. It makes it so that the muscles aren't as activated, and it makes it so you can't wear down the teeth. So it can help quite a bit for migraines and fracturing teeth and things like that. For people that have crowded teeth or teeth with other the malocclusion, you know, teeth in places that it's not as desirable to have them do the work we want them to do, you can have braces. So braces involve lots of little appliances on the teeth connected by a wire, and then elastics often. Sometimes people need to have jaw surgery to help fix if the jaws are different sizes, and that's what this looks like. This is a cartoon of what it would look like for someone who had that. And then for some people with braces, they can do the Invisalign, and that's what it looks like. Well, this isn't quite what this looks like, but it will look like little buttons on it, and then the Invisalign will come on. The big things about braces, though, is that it is a little misleading in that it's a long-term commitment. So once you get the braces off, you'll get these retainers, and you'll need to wear them. They call them nighttime for a lifetime. So if your loved one is thinking about braces and you don't think they're going to be committed to wearing the retainers for life, I really will often caution people to rethink it, because it's a big commitment. And then this picture is showing how if you don't have excellent home care when you have braces on, you can get the little starts of cavities all around where the braces were. And that's a really sad thing to take the braces off and see that. All right. So let's talk a little bit about some of the things that are more specific to Williams syndrome. All right, and that's a list we went through before. So, with Williams syndrome, a lot of it has to do with like the position of the teeth. So again, you can see, like we talked about earlier, if your shape of the teeth or the size of the teeth are different than the size of your jaw, that's going to lead to the teeth not being in a position that might be ideal for all the things we want our teeth to do. The malocclusion, so that's where the teeth are either crowded or crooked, and missing teeth. So teeth that just don't, your body just doesn't make, and it just doesn't show up. So all these things can be common with Williams syndrome and can make it a little bit more challenging to have teeth that are in a position that function the way we want them to. Another concern can be diet. So again, like we talked about before, to have a cavity, we need to have the teeth, we all have the bacteria in our mouth, and then the types of sugars. So just like we talked about last hour, depending on nutritional needs, your chosen diet, when you're eating during the day, and how often you can brush your teeth, all those things may lead to more reason to have to see tooth decay. In Williams syndrome, you can sometimes have the enamel, that outer portion cannot be as strong as we would like, and that because that barrier to help sort of set this in motion isn't there, you can have more cavities as well. So it can be both the diet and the home care things you're doing at home, and just the nature of the tooth that makes tooth decay more likely. The other issue that can come up in Williams syndrome is gastric reflux. So you can see, this is an example of very I'd say very severe gastric reflux, but it's common because it's with gastric reflux. If the gastric reflux is severe and there's a lot of acid in the mouth, it's going to cause wearing of the teeth. So these teeth are all going to be higher risk for decay because that hard enamel shell is gone, and it's just the dentin that's more likely to have decay that's there. Other concerns with Williams syndrome is just brushing your teeth. So I brought my friend. Some people know Toby. So this is Toby. So when you're brushing your teeth, you're going to want to brush. I guess I should come from this way. So you want to brush at an angle, like a 45-degree angle. You want to get all surfaces of the teeth from the inside, outside. Ideally, we want 2 minutes. So it's going to be, usually we say like 30 seconds per portion of your mouth. So all these things sound great and are well-intentioned, but if you're somebody who has poor muscle tone and that is common with Williams syndrome, you might have a hard time holding the brush. You might have a hard time angling it. If your attention isn't what we might want, you might lose focus and start to brush the same area for longer. So there's lots of things that can make brushing really difficult. Oftentimes if people come in and they say, I'm brushing for 2 minutes, I have all these things, I will often say, like, bring in what you're using at home and let me see how you're doing it, because doing it together, you may realize, like, well, we start off really strong and then we sort of get distracted by something else. And again, like I mentioned, the sleep dysregulation here, I'll put Toby over here. The sleep dysregulation can cause a lot of problems, because if you're going to bed at a different time of night, if your routine is off and you aren't remembering to brush, I think oftentimes people are very well intentioned. I'm going to brush before bed, but then you're watching a movie or you get up and you have another snack. So all those things can really lead to concerns, lead to problems with home care. Another thing with Williams syndrome is anxiety. So anxiety is going to make it really challenging to go to the dentist. The dentist is like very overwhelming environment. Of course, like past experiences play into it, the worry of pain, you don't know what we're doing, even someone who's like trying their best not to hurt you at all, like me, sometimes we do things that are uncomfortable, and fear of the unknown. So I think any of these things, if you're experiencing or you're worrying about it, to share it can help a lot. I think it's really important to make sure that you know what to expect during that visit. You know what the plan is for the day, what might hurt, what might not, what might be uncomfortable, how long it will take. And then another thing I find with my patients that have Williams syndrome is because they are just like almost always like the most lovely people, and they care so much about those around them. If they hear something else in the clinic, if they think someone's having a hard time, if they hear some noises somewhere else, they're going to be really worried about what might be going on in other parts of the clinic and who might be having a hard visit. So I think like all these things are really important to keep in mind. All right, so then on to some of my tips and tricks. I think we're doing okay for time? Yep, perfect. Good. All right. So here's me with my other nephew, Jackson. Look at him. He was a cool dude from the beginning. He had no problems, but I think it's really important to like set yourself up for success. So you have to remember that like you're the expert in you. Like I know a lot about dentistry, but like you know what works best for you. So you want to really be thoughtful about like, is there a best time of day that you might feel more comfortable being at the dentist? You know, if you're not a morning person and you're booking a 7 o'clock appointment, you're already setting yourself up for like an unpleasant time. You want to sort of give some thought to the busyness. So like some people I find love a busy waiting room. They love seeing people, they love seeing what people are up to, and they're just overwhelmed because there's a lot of people that are anxious about their own visits and it's like too much. Again, if like you're tired, if traffic is going to be stressful for you, you want to just sort of think about like what is going to be like the best way to get you through the appointment easily. And then I think it's really important like how we talk to ourselves and each other about upcoming experiences. So like just be, really thoughtful about talking about things in a positive way, not to worry about it too much, and to expect the best from it. Because I think sometimes, just like just like in this cartoon, the hygienist or the assistant's like, or the dentist is saying, say ah, and the kid takes it as ah, like they're scared instead. So I think like how we talk about it is really important. I'm also, for any caregivers here, I think it's like really hard sometimes not to put our own like fears and worries onto anyone that we might be taking there. So sometimes just keeping it positive is difficult, but important. And then I think it's really important to think about for yourself what might be triggering to you. So what might be like really hard if you have different things that make an appointment difficult for you. Make sure you sort of recognize it and share it. So again, like hearing other patients, sometimes people don't like that. Hearing the equipment, waiting room, is it overwhelming? Bad past experiences. Sometimes we have people that have had medical procedures that seem totally unrelated to dental, but when they're in that kind of environment, they find it really stressful. So any of that you can talk about. And then, the dental office just has like lots of weird smells and sounds and all those things. If it's something that might be bothersome to you, make sure you let us know. And then just like you worry about triggers, I think it's important to consider like comforts. So a lot of my patients with Williams syndrome love music. And even though you can't get up and dance, you can like listen to music. And sometimes that's a really good way to like calm yourself, take you out of the stressful situation. So, ask to put on your favorite type of music or bring it along with you. I think it's always important to allow extra time for like chatting, just so that you can, feel like the care team that's with you. Sometimes like stuffed animals, bringing a stuffy, maybe like Toby or maybe some other friend to hold might be helpful. And then everyone's a bit different about family in the room. Some people find it really comforting to have a loved one there. Some people find it that they're able to just focus on what they're doing better without having them there. So I think whatever you feel sets you up for success is important. This is my daughter a long time ago. This is our other friend. I don't think anybody's named him though. So one of the tools to help you better understand what to expect is this tell, show, do. So basically, like you might say, like, what are we doing today? What does it look like? Because I think if we're doing these procedures like fillings on teeth all day long, we might not realize that when we're coming at you with something like the cleaning solution we use, it looks like something else than what we need it for. So sometimes it's really helpful for us before we get started to just go through each of the steps. So we could tell you what we're going to do, we'll show you what we're going to do, and then we'll do it so you don't feel surprised. This picture is, some of me and my assistant Shannon. We had a patient that was a photographer, and while we were working on him, he's like, I have to take a picture of this, and I love it. So, but I think, you can consider for yourself, like some people like to stay with a pediatric provider. Some people like to go to like an adult dentist. I see patients of all ages, so it's easy for people to sort of stay with me and stay on. But I think you sort of need to think about what makes most sense for you and your family. Typically, like as we age, your teeth are more complicated, and most people will have to transition to somebody who takes care of adult teeth as well. But it's something to think about before you desperately need a dentist for that. And then that's funny, you forgot to floss. I guess like if you're a walrus, that's what it would look like. But you really have to be thoughtful about home care. So some people find timers work really well. Some people find stories or apps, modeling so that like, you and someone else in your household are brushing their teeth at the same time. But again, if it feels like you're trying your very best, you're doing everything you think you need to do at home, and when you go into the dentist, they're like, it doesn't seem like you're getting to whatever area, there's probably just something that either like you might be missing or you're not doing long enough. And to bring in the tools you're using at home into the office can help a lot, sort of help us make sense of what the difference might be. And then, like I said in the beginning, sometimes I take patients that really have a hard time in the clinic into the operating room to get their work done, because we know Williams syndrome has an increased risk often for general anesthesia. We really try to minimize the need for what we call full mouth rehab in the operating room. And I also think, like, you know, you're gonna have your teeth for a lifetime. The best thing I can help you do is to do as much work as possible in the clinic without needing to resort to the operating room for things. And then, so, you know, a tip or trick is definitely finding someone you feel comfortable with. So this is me and one of our periodontists, that's Dr. Della Russo. So you want to really find somebody who you feel like you can collaborate with, that you feel comfortable and not scared to tell them what you're worried about. And really that they can help tell you what they can help you make better, and things that are normal and not normal, and, you know, all the ways to keep your mouth healthy. But I also think you just need to keep in mind to be kind to yourself and know it's an ongoing process. So like all of us and all things change over time. So maybe what worked last year doesn't work now because you're on a new medication and your mouth is drier, or you started, you know, you're in a place where you're like snacking throughout the day, or you never had that available to you. But things like will change, or as we age, myself included, you break a tooth, or, you know, something happens that changes it. So it isn't we figured out what works, that's what's going to work forever. It's always like an evolving process. And then I love this quote, I think, because I'm a dentist, but so make someone smile every day, but never forget you are someone too. So as you're like caring for others, make sure you care for yourself as well. And I'm happy to take any questions.
What is your take on fluoride? My daughter uses a toothpaste that has fluoride. So her dentist recommends it for her. But there's also a national debate about fluoride, whether it's necessary or not.
Yeah. Yeah, so the question is about fluoride. I think I think like so much these days, people aren't always looking at like the actual problem, but like, you know, fluoride is like neurotoxic at high levels. Like there is no doubt that like there's a good amount for you to have. And typically what we want for like water fluoridation and in our toothpaste is a very healthy amount. It keeps your teeth really very strong without causing any of those side effects. So I think like that is one of the greatest like public health wins of our lifetime, is fluoride availability. So I'm a big proponent of it. We just know in areas that don't have fluoride, there's a lot more, there's a much larger decay risk. There's, you know, lots of other issues with like not having strong, healthy teeth. So like more tooth loss, more decay, more pain that's unnecessary. So I think it's everything in moderation, and having the right amount of fluoride makes a huge difference, especially if you have someone who might not be able to brush as well as you want to get that exposure to make the tooth like a little bit more resistant to decay, I think can help a lot. Sorry, did I see one over there? Oh, yeah. Yes. Yep. I heard she's beautiful too. No, just kidding.
Funny. What I like about her is when I'm getting my teeth done, she always asks me what kind of music you like, and I'm always say play something. And every time I go like this, every time she's doing a good job, or I go like this. So thank you for being a good dentist.
Oh, thank you.
So if you have fluoride in your toothpaste, what about fluoride rinses? Is that
I think it really depends on your personal risk. So I think for some people to have both won't hurt and can be very helpful.
So I wanted to go back to tips and tricks, reminders for home care. I mean, this is what I probably spend 15 minutes of every one of my sessions talking about. First of all, Jen is a godsend. I mean, finding someone who loves these patients and works with them so amazingly well. It's again, a godsend. So I'm not above bribing. Because what I mean, again, I talk to everybody about this, and the range of answers. How often do you brush your teeth goes 3 times a day to never. And I mean, when people are being honest, which I certainly encourage them to be, and again, the consequences of never brushing your teeth extend beyond the mouth. So trying to be creative, encourage. I mean, to me, toothbrushing is just like handwriting. It's a visual, spatial, motor skill. And we know that's an area of challenge. So being creative, putting the toothbrush and toothpaste in the downstairs bathroom, so when you're done with dinner, but also a reward system. I think, I learned about modeling. I like that one, but it's just a really tough skill. And I haven't figured out why some people just refuse, not going to do it.
Yeah.
And anything we can do to encourage a healthier home care, and then fighting with insurance to get people to the office 3 or 4 times a year rather than 6 times a year. But most of the care needs to come from home.
Exactly. Yep. For sure. Do I have like 2 minutes and do the game?
If the game takes 2 minutes,
Yes.
I know. Okay, all right, 2 more minutes. I'm sorry.
Okay. I have a quick game just because we talked all about how important smiles are and teeth are. So let's see. All right. So I'm going to show you a smile to show how important they are. And I'll see if as a group you can figure out whose smile it is. Okay. We have about 10 of them. You can just shout it out if you know. Yes. These are smiles are just so distinctive. I haven't ever had to care for someone like this. Lightning McQueen, yes. Woody, yep. Yep, Tiana. This is one of my favorites. Taylor Swift. All right, and then the last one. Yep. All right, well, thank you very much.
So we apologize. We know today is really long. We got so excited by the schedule. We kept saying, oh, we need to add so-and-so, and then so-and-so. So there are 2 more sessions, though there is coffee out back if you need. I'm going to try and, oh, goodness. Technology has figured out that I have no tech skills. So they were doing it for me. Thank you. This is Dr. Gretchen Dietrich. We wanted, after going through lists of things that can happen and potential problems, we wanted somebody to come and talk to us about strategies that you may be able to use. She's a licensed and board certified behavior analyst. She's the associate professor and chair of the Department of Behavior Analysis at Simmons University, and chair of the Behavioral Medicine Special Interest Group of the Association for Behavior Analysis International, has over 27 years of experience working with children and adults with neurodevelopmental disorders and their families to reach social, educational, and wellness goals. And finally, her research and clinical work focuses on lifestyle change using the science of behavior to help people improve healthy eating and activity to improve their overall health. So Gretchen, thank you so much for agreeing to come.
Hi, everyone. Nice to see all of your smiling faces, especially after the last game. I am so pleased to be here to talk to you about lifestyle change. I know it's been a long day, so why don't we all stand up, move a little bit, shake around, get the blood flowing, take a stretch. Good, good. Get some movement going and we'll get started. So I have I have a lot to cover in a short period of time, and I'm going to go through some things pretty quickly. Some of the information that I'm sharing today has already been discussed by our other presenters, but I'm hoping to close out my presentation with some helpful tips and tricks and some takeaways for today. So let's get started. So we already know that overweight and obesity and inactivity are associated with increased health risks. So you are at an increased risk for chronic disease and other health challenges by being overweight or obese, but also by being inactive. And we also know that the rate of overweight and obesity is increasing across the country, and actually we're seeing increases globally. And then we also know that very few people meet physical activity guidelines. So this is something that we want to improve upon for everyone. We also know there are a lot of benefits associated with healthy eating and staying physically active. It can lower our risk for chronic diseases. It can also improve bone health. It can improve your quality of sleep, mental health. There's a lot of benefit of eating well and staying active. But lifestyle change and following a healthy lifestyle is challenging. One of the biggest challenges is that we live in what we refer to as an obesogenic environment, an environment that really is sort of supporting less healthy behavior. And so that's something that all of us are facing, trying to lead a healthy life when less healthy alternatives are easy at our fingertips. And there's a lot of technology increases that are supporting more sedentary behaviors rather than physical activity. And one other thing that we know is that education is not enough to change our behavior. So everybody knows we should be eating more fruits and vegetables. Everybody knows we should be staying more active, but just knowing that doesn't change things. So we have to really work at it. We also know that there are health disparities for people with IDD. They're living with chronic and complex health disorders. You may be taking medications that also affect weight status or appetite. And so this poses an additional challenge. Also, we know that there aren't a lot of programs out there, and one of the things we hear from families is that some of the programs just are not a good fit. And so we really need to address this. And one of the common recommendations that we hear, and we've actually heard today, is lifestyle change. Lifestyle change is what we need. So what is lifestyle change? Well, lifestyle change, simply put, is increasing behaviors that are associated with improved health, decreasing behaviors that are associated with unhealthy behavior, and also trying to establish healthy habits for the rest of your life as part of your normal daily routine. That sounds kind of simple, but one thing I'm just going to share with everybody now, and I want you to all keep in mind, is that lifestyle change is hard. It is hard, it takes a long time. When we are looking at changing health behavior for the rest of your life, we're looking at gradual changes. So progress is slow, and progress is slow because slow progress is sustainable. And it's something that we can actually all achieve, but that means that it takes time. And the other thing is that lifestyle change needs a social team, social support to see those improvements. So we need to lean on others when we're trying to change our health behavior. And the other thing is that everybody is going to experience challenges along the way. That is just part of changing your habits. Sometimes it's easy, sometimes it's hard, sometimes there's lapses and slips, and that is just a normal part of the process. But because of those challenges, it can be difficult to stay on track. And so one of the things that is important to keep in mind is if you have access to a team of specialists or other people to support lifestyle change, that helps. If you're working with a doctor or a registered dietitian, nutritionist, they can help you achieve your lifestyle change goals. They can help you identify where to start. But the one thing is that not everybody has access to an excellent multidisciplinary team. And so the good news is that you can actually help and start working on lifestyle change yourself. And that's what we'll talk about today. The other thing is that with people with IDD, lifestyle change approaches need to be individualized. Everybody has individual needs. Everybody has different circumstances. You're starting at different places. Tools and resources may work better for others. And so we really have to think about an individualized approach and tailoring the plan to become more healthy, specifically to each individual person. And again, family support, team support, support from the people in your community is so important here. So let's talk about where to get started. Sometimes when we talk about lifestyle change, it can be overwhelming when you think about where you currently are and where you want to be. But what we do when we're trying to change our eating and activity habits is we focus on where we're at, and we pick one little area to work on, and then we gradually build on that particular behavior or on that particular area. And so start with one habit that you want to change, one food that you want to eat more of, one activity you want to do more of, and then build from there. The slow, small, but steady progress over time leads to sustainable change, and that change can be large over 6 months. So you can actually accomplish a lot by just changing a little. It's easier to get there, and it's more sustainable, meaning that it can last a lifetime. So some good examples of places to start for healthy eating are fruits and vegetables, eating more fruits and vegetables. Americans do not eat enough fruits and vegetables. This is a challenge for most of us, and it's a good place to start. The other thing to keep in mind when we're thinking about changing our lifestyle and our healthy habits is it's easier to add more behavior than it is to try and reduce the things that we're already doing. And so whenever you're thinking about where to start with lifestyle change, it's always better to add more foods rather than limit foods. This helps you avoid some of the challenges associated with taking away your preferred foods. We don't want to do that. But adding healthy fruits or adding vegetables can actually help replace some of those less healthy food choices without even trying to focus on it. So that's a natural change that can happen. The same goes with sugar-sweetened beverages. It's hard to decrease sugar-sweetened beverages, but by increasing healthier beverage choices, that can actually achieve the same goal without even focusing on it. So adding more healthy beverages or adding more healthy foods is a great way to start and to have success initially. I have on here trying new foods as a possible goal, but that's not going to be a goal for everybody. Trying new foods can be really challenging, and the goal is to be successful. And so if trying new foods isn't going to be a good choice to start off with, then focus on eating more of the healthy food choices. Eating more healthy foods is perfectly fine without changing the variety in your diet. So thinking about some targets for physical activity, the one thing I'm going to stress right now, and it's been mentioned earlier today, is that when we talk about physical activity, we're not talking about strenuous exercise. We're talking about moving. We're talking about being active, standing up, moving around, stretching your arms, dancing. That's movement. And what we want to focus on is actually moving around, being active. So that physical activity, it doesn't have to occur in any specific location. Physical activity can happen anywhere. We just all did it a few minutes ago. And physical activity can be fun. So dancing is physical activity. playing games, playing with the dog or the cat. Those are all ways to stay active and move. And those are things that can be a lot of fun. So sometimes when we're thinking about where to start with physical activity, we may focus on things that are easy for us to count, like steps, because there's pedometers and fitness devices that can help us tell if we're actually increasing our physical activity as far as steps go, or increasing just movement in general. So you may think about how often you're moving today, and then try and move for a few more minutes the next day. And just like I mentioned with decreasing sugar sweetened beverages or sugary foods, decreasing screen time can be a challenge. And so decreasing screen time can actually happen naturally as you're increasing physical activity. And we would always encourage you to focus on increasing the physical activity, increasing the movement, rather than reducing the screen time, especially when you start off with lifestyle change. So one of the first steps to get healthy behavior to happen and to continue to happen is just getting the behavior to happen once. And then once the behavior happens, if we reward that behavior or reinforce it, then we can gradually build it over time. And as it builds slowly and surely, it becomes part of the routine. It becomes easier, and it can happen for longer periods of time, a larger amount, and so on. And so the key is starting with just one instance of behavior. And then we can make it grow. So when we're thinking about starting healthy behaviors, we want to reward the healthy behavior as soon as the behavior happens. So if we're thinking about healthy eating, eating a serving of vegetables, or even eating just one bite of a fruit is an excellent place to start. Reinforce that, reward that, give high fives, celebrate that success right there in that moment. That helps identify what it is that's happening, and it helps build that behavior, that healthy behavior. We can also use delayed rewards for meeting goals at the end of the week, or for meeting goals consecutively, or actually meeting a personal best. So delayed rewards can help keep the behavior going, but the immediate rewards help it happen in the moment. And so when we're thinking about what immediate rewards may be useful to use, immediate rewards are generally free. It's high fives, thumbs ups, praise, fist bumps. It could include checks on a tracker or point sheet where you're keeping goals. There's a lot of things we can do right there in the moment that are going to be an excellent encouragement for the healthy habit and healthy behavior. And then when you're thinking about those delayed rewards, those are usually bigger items. So maybe a special activity or a special purchase that you're reserving just for meeting goals. You should talk about what those rewards might be and what works best for your family and what you want to earn. It's a family discussion, and so make sure you're thinking about what works. And these things can change, and they should change. So the other thing that to keep in mind is if the behavior is not happening already, there are different strategies we can use to try and get the healthy food choice or the physical activity to happen. And one of the best ways to do this is by actually modeling that healthy habit yourself. So say what it is, take a team approach, and everybody do it together. So today we're going to eat, one piece of fruit as a family or as a team. Do it together, model that healthy behavior, and that can help. It provides the support, it provides the everybody doing it together team approach. And when you're thinking about what that behavior is, again, think about something small. So if you're not eating any fruits, then don't make the first place to start be a whole apple. It would be a piece of an apple. Or if there's not a lot of physical activity happening during the day, start with a few minutes of dancing. 3 minutes of dancing is perfectly fine and a lot of fun. And 3 minutes can lead into a lot more dancing too. You can also use some strategies for pairing preferred foods or activities with the new healthy behavior, and I'll talk about that in just a second. Or substituting some of the less healthy choices with healthier choices that sort of meet the same taste, textures, sensations. And then you can also build rules about where the behavior should occur. So, for example, not eating in front of the TV or computer, or eating at the table, or screen time happens only during a certain time of day. So sometimes rules can help encourage the healthier habits. So let's talk about pairing healthy food choices. I've got some great examples of how to pair veggies with dips, fruits with dips, and physical activity with music and fun. One thing that I hear a lot is, but ranch dip isn't that healthy, and that's true. But the goal is to get the veggie in. And so eating veggies with ranch or eating veggies with other dressings or dips is excellent because the veggies are getting in. You can change the dip or change what you mix it with over time. But the first step is getting that veggie in or getting that fruit in. You can also make the food choices fun. And so I would encourage everybody to look at some of the fun recipes that are there for eating veggies or fruits. There's a lot of really fun ways to prepare foods. There's a lot of different ways to prepare vegetables in particular as well. So they're not soggy, they're more flavorful. The celery with peanut butter and ants is a great example of a fun way to eat vegetables and fruits and protein. But you can think of creative ways to get the vegetables in and get the fruits in. It doesn't have to be just the fruit sitting on a plate. And then here's some ideas of ways to substitute less healthy choices for healthy choices. Whenever you're thinking about what to substitute, you want to try and match what the sensation is, what the flavor is, the temperature. So trying to make that match can make it easier for the healthier food option. It can make it more palatable. So instead of soda, flavored seltzer water, you get the same bubbles, you get the same temperature, similar flavors, but a little bit more healthy. Frozen fruit kebabs instead of popsicles. It's a great way to get some fruit in, a lot of fun, and can be frozen to give that same sort of summer snack experience. So I'm going to shift gears and talk through the different components of lifestyle change. These are components that have been demonstrated in the literature and research to be effective elements of lifestyle change. And so following these strategies will help as you try and work through changing eating and activity levels to follow a healthier lifestyle. So the first step is tracking your health behavior. And the reason why tracking is so important is it lets us know where we're at. You're not going to know if you've changed the healthy behavior if you don't know how much is actually happening in the first place. And so we have to think about what is the behavior that you want to change. Is it eating vegetables or fruits? Is it being more active during the day? And then that can help you identify how to keep track of that behavior. So for eating, I recommend looking at servings of food groups, not calories, because that is the actual behavior we want to see is eating the food, right? And the calories are more abstract, but it can also distract from the whole goal of just eating a healthy diet, getting a variety of foods in. As far as physical activity goes, counting the steps is easy because there's a lot of fitness devices out there that do it for us, but also just the total amount of time of being active during the day can be a great way to track healthy behavior. And once we've identified how we're going to track the behavior, then we're going to look at our baseline levels. So take a week and look at how much fruits, vegetables, other foods are being eaten during the week, how much activity is happening during the week. And that can give you information of where you're at, where you're going to start. Again, we're starting where you're at, not at some other health standard. It's where are you right now in this moment, and then we're going to build there. The other thing that the baseline can give us is information about when healthy and unhealthy behaviors are more or less likely to occur. So what are some of those times when there may be triggers for less healthy food choices or more sedentary behavior? That can help when we're trying to arrange the environment and set ourselves up for success to encourage healthier choices. So once you have your baseline information about where you're at, then you're going to start setting goals. And we set two types of goals when we're trying to change health behavior. The first is a long-term goal. So that is looking ahead, 6 months from now, maybe a year from now, what would you like to see? What kind of healthy eating would you like to see? What kind of healthy activity would you like to see? And then write that down. That is your long-term goal. The short-term goals are looking at your baseline, your current level of healthy eating and activity, and moving one step a little bit closer towards that long-term goal. So the short-term goals are set usually a week, sometimes daily, depending on how hard the behavior is, how much of a challenge it is. Sometimes longer as you're growing accustomed to lifestyle change. But we set that goal, the short-term goal, to move gradually closer and closer towards the long-term goal. And again, it's gradual change over time. Gradual change it's easier to get to the goal. It's easier to sustain it long-term, and it's easier to become part of our normal daily habits. So when we're thinking about setting goals, we want to follow what's called a SMART goal. So a goal that is specific, measurable, attainable, realistic, and time-based. And I'm going to talk about each of these components now. So when we talk about a specific goal, or the goals being specific, what we mean is that the goal very clearly identifies what that healthy behavior is, how much should occur, and how often or for how long. So an example is eating a serving of vegetables. Eating the serving of vegetables is the behavior. How much, one serving, how often, 4 times or 3 times in a week. So that makes it specific. Everybody knows what the goal is. We can see the behavior and we know how much and how often. Measurable means that we have to be able to observe the behavior and we have to be able to write it down. And so this goes into tracking our goals. But you want to look at goals that you can actually write on a goal sheet and determine if progress is being made. So 4 servings of a food group is something that we can measure. We can see how many servings were consumed. We can track it, each serving, and we can see if we're making progress. Or, dancing for 5 minutes. We can tell that dancing has happened for 5 minutes. Attainable is where it gets a little bit trickier. So when we're thinking about goals that are attainable, we have to think about goals that are a little bit of a stretch from where we're currently at, still a challenge, but not such a big change that it's not possible to meet that goal. And so some examples are moving from 4 servings to 5 servings, or moving from maybe 1,000 steps to 1,500 steps a day. Those are goals that are a bit of a challenge, but it's not too large of a change where it's not going to be likely to meet that goal. Realistic is thinking about, given the resources and the time in your schedule, is this goal realistic? Is it something that could happen, considering everything else that is going on, considering what resources you have available in your house? schedules. And so it's important when you're thinking about goals to make sure that you're thinking about goals that could happen really in any location. Don't set a physical activity goal that requires you to be at the gym every day, because you could run into transportation issues or things could change. And having it tied to a location makes it really hard to meet that goal because of changing resources day to day. So make sure that the goals can happen around the schedule. Make sure that you have the foods on hand to reach the goal. So if you're setting a goal of eating a specific food, for example, make sure that the food is in the house so that the goal can be met. And then the last component is time-based. So set a deadline. We need to know when the goal should be met, when the goal ends, and that can help us determine if the behavior actually happened and if we met the goal. Setting deadlines also helps motivate. So you can check on the goal daily and see how close you are to the deadline, and that can help encourage the healthy behavior to occur as you're getting closer to that deadline. If you still have some more servings of foods or more activity to do before meeting the goal. So I mentioned this before, but I'm going to mention it again. It's important when you're starting lifestyle change to focus on increasing behavior. So adding more healthy foods to your diet, adding more physical activity rather than restricting eating or restricting certain activities. This helps avoid some of the unwanted battles that might happen or struggles with losing access to or not being able to have your preferred food choices or preferred activities. It's always easier to add more than it is to take something away or restrict something. And again, starting with fruits and vegetables is a great place to start because everybody can usually increase fruits and vegetables in the family. And taking that team approach is really a great way to get everybody together to provide the support needed. Dancing is always the best way to be active, in my opinion. But so when you're thinking about setting short-term goals, again, you want to look at where you're at now. So look at the baseline, then look at the long-term goal, and then look at that small increase from where you're at closer towards the long-term goal and what you can do in that week. So once you've identified what that goal will be, write it down, check to make sure that it meets the SMART goal requirements, ask for some help, check in with your family, see if everybody agrees that it meets the SMART requirements, that it is something that can actually happen, and then write it down and finalize that goal. And think about the rewards that you might want to earn for meeting that goal. So here's an example of a goal setting form, and I actually have provided a blank copy of this as well. This goal includes healthy eating and healthy activity, so physical activity. But keep in mind, if you're not concerned with increasing physical activity, if activity is occurring at a really healthy level, then you don't have to set a goal around physical activity. So again, everything should be tailored to your needs and what works well for you. And so just as a quick review, this first goal for healthy eating is I will eat 1 serving of vegetables 4 times per week. So we've got our behavior, it's specific, it's measurable, it's attainable if we assume that we're starting at 2 or 3 servings per week. Realistic, it can happen anywhere in the house or in the school or work environment, and can happen really anytime that week. And then we've got a deadline. So we're doing this from Sunday to Saturday. And so when you are setting your goals and working on your goals, you want to monitor your goals, check in daily, look at how you're doing so far, talk with your family or support person about how you're doing and what you can do to work closer towards meeting your goal for the week. You also are going to look at your goals at the end of the week or the deadline that you've set and see how well you did. And so if you've met your goals, then you're going to adjust your goal up a little bit, just a little bit. Remember, you're making it a challenge, but still attainable. If you didn't meet your goal, then you have to reassess and think, well, was it too much? Were there issues with resources or barriers or scheduling, and talk through that. And maybe you work on the same goal again, or maybe you change it to a little bit less. But this depends on everybody. It's individualized for everybody. And so whatever works for you might not be the same as for somebody else. And so the goal really, when you're setting your goals, is to adjust as needed based on how you're doing and where you want to go. And so again, we're looking at a gradual change over time, that slow, steady progress over time towards that long-term goal. That is going to help encourage healthy habits that last a lifetime. The other thing that happens when we're setting our goals for eating healthy foods and staying physically active is that it can help encourage healthier habits and strengthen the healthy lifestyle and the routine. And so by setting your goals, without even trying, you can establish healthier eating habits and mealtime routines and scheduled activity throughout the week that helps also contribute to a healthy lifestyle. And then reinforcement, again, as soon as that healthy behavior happens, give those immediate reinforcers, the rewards, celebrate successes. For the goals at the end of the week, you're going to use those delayed rewards that are bigger ticket items. And also thinking about having special rewards that you reserve just for really challenging goals or meeting goals a couple weeks in a row. Talk about what those rewards might look like, talk about what you want to earn, and then write it down on the goal sheet so everybody remembers what you talked about. So one of the things that's really important when we're thinking about lifestyle change, in addition to setting goals and trying to reward healthy behavior and just having that gradual progression towards our long-term goal, is setting yourself up for success. So look at the environment, see, are there any activities, people, factors or variables in the environment that may encourage more healthy behavior or maybe triggers for less healthy behavior. And so what you want to do is try and increase those aspects of the environment, the home, school, work, that are going to promote healthy behavior, and then try and reduce or avoid some of those things in the environment that may trigger less healthy behavior. And so here's some strategies for helping to encourage more healthy behavior. So one of the biggest challenges with healthy eating is that it often takes a lot more time to prepare healthy choices. And they're not necessarily at our fingertips like less healthy foods and snacks are. And so if you can get healthy, like cut up fruit or veggies and dip, prepared ahead of time, keep those at eyesight in the fridge. So it's the first thing you see when you open the fridge, or keep them in the pantry or the cabinets. So they're right at eye level. That being the first thing that you see may help encourage that as a healthier food choice. Preparing the food ahead of time helps Meal prep is a lot of work though. So try and get the whole family to help with meal prep if you can. You can also rely on frozen and canned foods. There's lots of healthy choices there, and actually frozen fruits and vegetables are frozen fresh. So sometimes you're getting them in better condition than the fresh produce at the store. And then talk to people in your social networks and your social groups about your goals, and try and get people to encourage and support the healthy choices everywhere you go. And then as far as physical activity goes, scheduling physical activity is always helpful, but the other thing to keep in mind is you can squeeze little bits of physical activity in throughout the day and reach a goal of being active 30 to 60 minutes a day. 5-minute little bouts of physical activity squeezed in between working, squeezed in between talking to people or sitting. If you're watching TV, a commercial comes on, stand up, move around for a few minutes, be active while you're watching TV. You can squeeze in a lot of physical activity with short little bouts throughout the day. And there is research that suggests 5 to 10 minutes is over the course of a day, up to 30 minutes can be just as healthy as one 30-minute bout. So it doesn't have to be a big bout of exercise in a short period of time. It can be little bouts throughout the day. Park farther away. Everywhere you go, park a little bit farther so you can get a few more steps in. Think about fun games or social activities you might be able to join to get more active with friends. And then limiting screen time, again, that might not be a good choice or what you want to focus on right away. Increasing physical activity can help address that by replacing more physical activity with the sedentary activities. And then social support. Look around you. Think about who is in your family who can help, the people you work with or go to school with, people you interact with, your friends. Who are the people who can help you? Who are the people who are also trying to follow healthy life? They can help you, encourage you along the way, help you if it gets challenging. And so lean on your friends and family for support. And there are going to be challenges along the way. That is a fact. It's going to be challenging. There are different events or people or things that happen in our life that are triggers for less healthy behavior. And so one of the best strategies is identifying those situations and planning ahead. Can you talk to a person who might be encouraging less healthy behavior and say, hey, this is my health goal? Can you plan ahead if you're going to a party to try and bring a healthy snack or try and get some physical activity and movement in during that activity? So planning ahead and practicing that plan before you get into that situation can help. And then look and see how well it worked. It may need to be adjusted, but just try and evaluate and then try again. And keep in mind that lapses happen. Again, this happens for everybody, and it will happen multiple times along the way. So be kind to yourself. Don't dwell on the lapse. Don't worry about it, because you've got the tools and strategies to get back on track. Adjust your goals. Try and start again, and just keep focusing on reaching that goal, and know that this is all normal, and it happens to everybody. And then as far as maintaining healthy lifestyle for the rest of your life, some of the things that we know from the research is that if you stick with the plan, you stay active, you eat your healthy fruits and vegetables and try and follow healthy eating habits and physical activity, then that can help you maintain those healthy habits and the healthy lifestyle for the rest of your life. Sometimes you may not have to keep track of your eating, or you may stop stop looking at goals, but you may have to go back to those goals if you experience a lapse. So just know that things are going to shift along the way. And as you age and get older, things will change. And so you may have to adjust your habits and your plan and your lifestyle and reassess your goals just to get back on track and maintain your healthy lifestyle. And just stay active, rely on your friends and family, keep eating your fruits and vegetables, and know that you have this. You've got the tools and resources. You know what you're going to do. You can do it. It takes time. It's gradual progress, little bits of change over a long period of time produces a large amount of change and something that you can do for the rest of your life. And just know you can do it. Healthy lifestyle is a journey that takes one step at a time. Be kind, give grace, and know that this is something that you'll be working on the rest of your life, but one step at a time, one moment at a time, one bite at a time. And you've got this, and you've got friends and family and community to help you. Thank you. I do have some resources and tools for everybody. Banana ice cream, I just want to point out, is binding. And so if that might not be the right choice for everybody, but I've got some other resources available of goal setting form, healthy eating books. And thank you, everyone. How can they get the resources? How can they get the resources in the slide? Oh, okay, the slides, everything will be on the website. Or you can also email me too. I'm happy to share anything. Yep, okay, questions. Any questions? I know it's been a long day. Yes.
Can you go back to the smoothies so I can?
Yes. And this is a smoothie recipe. It's got lots of different ways to adapt that recipe for different dietary needs. So you can make it dairy-free if you want. You can substitute a lot. Get creative. Yeah, just smoothies are a lot of fun to make, and you can be a food scientist. Try different variations and see how it works. Any other questions? Yes.
So for a person who has like texture issues with certain foods and drinks and stuff, what would you recommend them to like eat or drink? That way they can still get that food that they need and still be like have a healthy kind of habit.
Yeah, that's a great question. So for somebody who has some texture preferences and is looking to try and increase healthy eating, I think that's where you think about what are the textures that you like and what are the tastes and the foods that you like, and see if there's a way to eat some healthy foods that are in those textures that you like. You know, when we're talking about lifestyle change and we're talking about changing our habits, we're always starting with where you're at. So what are you eating now? And kind of building from there. Yeah, and you know, textures are challenging sometimes, and there's different ways that you might be able to, or different foods that you might be able to find that are healthy, that have a different type of texture or taste. Yeah. Thanks.
For texture transition. So they don't like bananas, for example, but you take one bite of a banana and they make it. You don't like transition.
Yeah. So they call it, well, as a behavior analyst, we call that shaping, but it's also called chaining, like the see it, smell it, taste it, touch it, take a bite. And sometimes that works. Sometimes it does. Sometimes it's hard. And so I think focusing on where you can be successful is the key. And one thing that happens over time is the more even if it's just a teeny little taste of something, the more you try something, the more you develop a taste for it. And that may be trying to pair it with some of those like other things that you are eating, that can help. But just whatever is working for you, take it slow, step by step, bite by bite, can help. Yeah. Okay. Thank you, everyone.
Thank you so much, Dr. Dietrich. What a helpful and practical presentation to end with. At this point, I'd like to invite Dr. Chris McDougall and the 4 adults who are going to be part of our wrap-up panel to come to the stage. He'll take a couple minutes just to get set up. Is that working?
Yes.
So this is our last presentation for the day, and I think it's one that you'll all enjoy. We're very fortunate to have Dr. Chris McDougall. He's a psychiatrist and the director of the Mass General Lurie Center for Autism, moderate a panel which includes 5 adults with Williams syndrome. Chris, I'll ask you to have each of the panelists introduce themselves, and then I know that you'll be talking about health and what healthy means to each of these adults. Thank you.
Well, hello, everybody. I guess this is the last show, so then it's over and you can relax, and hopefully it's been a good day. Thanks to Dr. Pober and Dr. Tom for putting it together and the rest of their team, and to the Bernan family who support the Williams syndrome program at MGH. I'm going to go down and just tell me your name for starters, and then I'll come back around, okay? Oh, you've got your own microphones now. All right. Thank you. So why don't we start with ladies first down at the end? Just your name for now.
Hi, I'm Svetlana Goldberg. And what healthy means to me, I like staying active, staying like, like moving and eating healthy, having smoothies and stuff. And that's what healthy means to me.
Great.
Hi.
Hi, my name is Tiana Davis, and I do nutritionist. I'm exercising, being healthy, and enjoying being healthy.
Hello.
Just borrow hers, maybe.
Hi, my name is Ariana Gallagher. My thing that makes me healthy is being around my friends and talking to my therapist.
Hello, my name is Brett Glazer. For me, being healthy, I play tennis twice a week. Love to walk and have really gotten during the summer eating a lot more vegetables now that they're a perfect time to eat and trying to really stay healthy.
Hi, I'm Luke. I'm 37 and I stay healthy by working, walking, and hanging out with my friends.
Okay. So everybody's talking about vegetables, you know, but not all vegetables taste good, right? There's some I don't like. So I want everybody to name one vegetable that you don't like.
Broccoli.
Nice.
Avocado.
What'd you say?
Avocado. I don't like the
All right.
texture.
Brussels sprouts.
Ooh. How about your neighbor there?
Broccoli.
Broccoli, yeah.
Broccoli.
Wow, broccoli.
I love broccoli.
Broccoli, 3 people don't really care for it. Avocado, I don't like guacamole, do you?
No.
Nice.
Boom.
All right.
Maybe green bean.
What's that?
Maybe green bean.
Green beans you like or not like?
Don't like.
Oh, okay. Well, now name your favorite vegetable.
Cucumbers.
Go ahead.
Cucumbers.
Cucumbers is your favorite. All right.
Cucumbers as well.
Oh, man.
I like corn,
How do you like it? What kind of corn?
just like regular fresh, not like the bag kind, just regular fresh corn.
Corn on the cob?
Yeah.
All right.
I'm going to disappoint everybody. Green beans and broccoli are my 2 favorite
All right.
vegetables.
Nice. Now, did we hear from everybody or not yet? Your favorite?
Corn.
Corn. All right. All right. Now, today's conference had a lot to do with like the stomach, didn't it? And have any of you had any stomach issues throughout your lives? And can you talk just a little bit about it and what seemed to help it? You want to start again?
So when I was born, I had acid reflux all my life, and the only thing that helps me the most is probiotics. With doctors, it's kind of hard for me to like go to new doctors, and I just recently did endoscopy, just got tested for Barren syndrome, and I was negative. So yeah, I was born with it all my life.
How about you, ma'am? What's that?
She's gonna think about.
Think about it. Okay, Ariana.
I think for me, it's just eating food that is healthy and being aware of food that's not healthy and not trying to get sick from unhealthy foods. Even going to certain places, different places, being in college, and getting food poisoning and things like that, being aware of what's healthy, what might seem not healthy, and look at the food and be like, okay, I'm aware of this. Let's not eat this. Let's eat something else.
Sure.
I was once on the metformin and I had to get off of it because it was killing me in many ways. Felt like someone was taking a baseball bat to my stomach at times. And now I'm on, now I am back on metformin in a lower dose, and the long release has helped, and it's been very helpful.
What's it help you with?
Uh, my food cravings
Uh-huh.
and stuff. I'm always afraid that I'm gonna get sick in general,
Yeah.
and it drives me nuts. I'm always afraid to try new stuff.
Yeah.
But my nutritionist convinced me to try it one more time, and we tried a different form of it, and it's worked a lot. And I'm also on Zepbound at the same
Oh,
time.
nice. How does that work? I've heard about it.
So I take a shot in my arm, like right around here. I switch every week, arm spots, and it has really helped. So far, I'm down 4 pounds on it, and I take it every Tuesday. Thank you. But it has really changed me. Like, I don't have the food cravings anymore that I used to. I honestly didn't believe in any of this stuff, to be honest. I thought it was just kind of like crazy.
Sure.
That a shot would like help so much. And the most I've gained personally is I'm afraid of needles in general. So to do it, it takes a lot of courage for me, but I've seen the results, so I'm going to keep doing it.
Wow.
Can I add something?
Go ahead. Yeah.
A couple weeks ago, I had amoxicillin from an ear infection.
Yeah.
And it totally damaged my stomach. Like, it made me feel worse. It made me feel like drowsy and tired. I never liked amoxicillin. So I told the doctor I need to stop having that because otherwise I don't want any more problems.
Yeah, you guys are pointing some things out that are important that, treatments that doctors recommend don't always work or they're hard to tolerate. So I think it's important for doctors to listen to you guys when you give them feedback and to your family. And it's really a team approach to try something that might work. Now, Mr. Glazer.
Yes.
Guess what? I know a friend of yours.
Oh.
Yeah, Dr. Pober.
Yeah.
And you know what she said to me?
What?
She said she wants to play you in tennis.
Bring it on.
That's a nice attitude. I like it. You think you could teach her a few things on a tennis court?
Yeah, but no, I know she's a great player, but we'll have fun.
Dr. Popper's hiding.
So I'd like to know what your favorite type of ice cream is.
Oh, me? Okay. My favorite type of ice cream is vanilla. I love vanilla ice cream.
Classic, straight up.
Classic.
Yeah.
I like chocolate and vanilla.
You mean
Scoop.
a little bit of both?
Yes.
Okay.
I like vanilla and cotton candy.
Ooh.
Now, wait a minute. You describe that for us, what you mean.
So like if I don't feel like eating vanilla ice cream, I'll just go for cotton candy ice cream.
Cotton candy ice cream. What color is it?
Like it's pink and blue.
It's got it all going.
Yeah.
Wow. What about regular cotton candy?
No, I don't eat any of that.
It's kind of weird, isn't it? I mean, it's kind of different. I don't know.
I don't go towards my times for that type of stuff.
Okay.
Strawberry or Oreo?
Strawberry or Oreo?
Yeah.
Okay.
Mint chocolate chip?
Mint chocolate chip, is it the green kind or the white kind?
White kind.
The white kind, because there are at least two types, right? Yeah, my favorite is Baskin Robbins peanut butter chocolate for whatever reason.
I love their vanilla.
You like their vanilla? You know, the thing I really like is a vanilla malt. Now, you guys out here on the East Coast, you have these funny words for things like something called a frap.
Yep.
F-R-A-P-P-E.
Like frappuccino?
What's a frap?
It's like in the ice cream milk. It's what What you guys will call an ice cream milkshake, but you ask for a vanilla frap or like.
Yeah, so I'm from the
From
Midwest,
Starbucks.
you know, and we just say what it is, like a milkshake. We don't have to add a fancy word that you don't understand. So why do you have to say frap if you can just say milkshake? What do you think?
I'd rather say milkshake than frap.
All right,
Milkshake, frap. I mean, frappuccino's like, it's soft, but it's like,
Oh.
in Starbucks. I think
Fancy
it's the
word.
best during the winter because you get a frappuccino and then sometimes it's like, ooh, and then sometimes if you want to call it, like, yeah.
Yeah. Now what's the difference between a milkshake and a malt?
I have no idea.
I have no idea.
All right.
They use a malt powder to put inside the milkshake.
That's it. That's the best way to go is vanilla malt is the best way to go out of everything we've talked about so far. It's interesting how different places in the country use different words for the same thing. You know what they call a milkshake in Rhode Island? What? Where are you? That's right, a cabinet. Now look,
A cabinet.
I grew up in Indiana, like a
Cabinet?
cabinet.
That's weird.
Like it's sort of like this. It's like a cabinet. No, in Rhode Island, they got bored and they said, well, we need a special name for a milkshake or a malt or a frap because we're in Rhode Island. Why don't we pick a type of furniture? And we'll call it a cabinet. What's that all about?
That's some
I don't
BS.
know.
Yeah, okay, well. Now, what about, we've talked about physical health.
Oh, no.
And everybody talks about mind, body, and they're both important and all that. Talk to us about mental health, if you will. What do you think about that?
Like the question?
Yeah, when you hear the word mental health, what's it mean to you?
Like, when someone has like mental health, it's when you like are struggling or something, or someone needs to get checked with their mental health. It depends on the person. It depends anxiety wise and people. That's what I'm saying.
Somebody told me that anxiety is common in people with Williams syndrome. Is that true?
Yes,
Yes.
Okay.
yes.
So
I got tested by Dr.
Tom? No.
Dr. Tom,
Yeah.
and I realized I thought I had bad anxiety, but I had mild anxiety.
Wow.
So I had tiny
Yeah.
anxiety.
And how do you know when you're anxious? Do you feel something in your body that tells you, or how do you know?
I get tense.
You get tense?
I get tense, and I cannot find ways sometimes to calm down, but in some ways I try to, but it's hard sometimes
Yeah.
when I'm tense.
Yeah. Ma'am, go ahead.
I get when I feel very lonely and depressed and anxiety kicks in, they
Uh-huh.
both kick in, forget about it. It's so hard to calm myself down. And sometimes I like to walk around the house to make sure I'm calm after. Walking makes me feel better. Talking to people makes me feel better. Learning who you can trust and who you can't trust. The
So
right people.
you find that sometimes you're lonely and depressed and then it can turn into anxiety. Yeah.
Yes, and that's when I like to eat sometimes.
Yeah. Yeah. Anxiety, do you know what anxiety feels like, or what do you think?
Yeah, I think anxiety to me is just like, for me, I'm always aware of my surroundings. I'm always aware of where I'm at and like what might cause me to get anxiety, and like being surrounded by people that I know that I trust and know that I don't trust, and just being like cautious and being aware of like what I want and what they want.
Yeah. Are there any things like in the world, that could happen that would make you feel anxious? Like sometimes what I've heard is some people with Williams syndrome, certain sounds or something, loud noise, or I don't know. What do you think? Ariana, what do you think?
I think for me, I think it's just like maybe being around huge crowds of people that makes me very claustrophobic and just uncomfortable. You know, like if I'm at a store or whatever and there's so many people in there, I just can't get the access that I need because there's so many people in the store. And so it's just not easy sometimes. I learned this advice from my therapist for myself, but for everybody else, and that is nobody can change you who you are besides yourself. And that it's a big deal for me because it's sometimes not easy having Williams syndrome because sometimes people don't understand what Williams syndrome is and they just treat you with so much disrespect and rude and harsh on you. And I try to not take that as seriously, but that is an advice that I take like very seriously.
Yeah.
And I think that everybody should take that too because of how hard our world is dealing with right now.
Yeah, that's terrible to hear that you experience that at times. Yeah. Mr. Glazer?
Well, with everything going on in the world right now, one of my dear friends was shot a long time ago and passed away at a young age. And with all the school shootings and everything, I work for my beach and rec department, so I'm at the beach all the time. And we have football games and stuff there. So I always am kind of like nervous if I go to work, but it's the thought that something might happen, even though I don't think it will. I just have that anxiety sometimes. Yeah. And it's hard for me to deal with sometimes, but I have a lot of good friends that have been there for me with certain things. But with all the, not to like talk politics or anything, but with all the shootings going on, it's been I'm very more anxious.
Yeah, wow. That's scary. You are too? Wow.
Yeah.
What beach do you work at?
The Madison Beach and Rec Department.
Nice.
In my town, I've been there 25 years.
What town?
Madison, Connecticut.
Oh, I know Madison, Connecticut. That's a nice town, huh? Yeah. Sir, what do you think about mental health?
Mental health is like very much an important thing. I think honestly, because if like without mental health, you're not like in control of yourself. And sometimes you just need like a 10-minute break just to sit down and relax or put on your headphones and listen to music for a few minutes and just relax by yourself so you can collect your thoughts and just be yourself and not have to worry about anybody or anything around you and what you have to focus on for yourself.
These people are really good at expressing their thoughts and their feelings. You know, not everybody with Williams syndrome is as able as you guys to communicate their thoughts, but you know, I'm sure they experience anxiety as well. It probably shows up in other ways. You might see it on their body, but I know it's a lot that you guys deal with. Now, here's a question. So some people, Dr. Pover and Dr. Tom would say, Dr. McDougall, you should ask this question. What's the relationship between anxiety and stomach stuff? Are those related?
Very related. I got diagnosed with diverticulitis in IBS way back in right after like 2016 or something. Sometimes when I get overwhelmed, my stomach starts to act up. Then all of a sudden I'll be fine 1 minute. The next minute I'm in the bathroom and I'm like not feeling the best. And then all of a sudden, did I like eat something I wasn't supposed to eat? Then all of a sudden I realized, no, that's anxiety from everything going on around. And I just got to take a breather and just like talk to somebody and just relax myself for a little bit. And then I feel better.
Complicated.
Yeah.
Could I just say something?
Yeah.
I get very constipated when my stomach bothers me, and I try to relax and go to sleep. It never works out. I'm always it's terrible.
And does constipation then make you feel anxious or not?
I don't think it makes me feel anxious. I think it's like just, you're very, very constipated and you don't know what to do. There's Tylenol if you want to take Tylenol, there's Advil, all that other stuff that you could take. And it really relaxes me later on.
Okay, good.
I think it's, for me, is having your whole body react to something that you eat. Like for me, when I was in college, I ate quesadillas. I got food poisoning. I've never gotten food poisoning in my entire life since I was little. So the feeling of my body reacting, and then after letting all of that like vomit and stuff out, like a few days after, my back was in so much pain and I still felt nauseous. So it's just, you have to be like aware of what your body reacts to and how it reacts, and how like you might feel like, oh no, like this is gonna happen and I might vomit. Just be aware of like how your body feels, and if it doesn't feel good, then go to the bathroom or try to do something that will help the constipation go down.
For me, with the anxiety and the stomach, it's kind of complicated. I'll mostly deal with it every day, honestly. My nervousness doesn't start with myself, it starts with my stomach. And then I get nausea and I have to find some kind of medicine to control it. It depends. My mom always reminds me to take probiotics, take smoothies, because that's the only thing that helps me to this day for now. But other stuff, it's kind of complicated. That's why I'm looking for a different doctor now for this, hopefully to know more about reflux disease in the future.
So this anxiety and GI stuff runs together. Say, Mr. Glazer.
Just to go back one question.
Sure.
Stop saying.
Yes.
He said he likes to have 10 minutes to himself. Sometimes I go for a drive to just forget about everything and just go for a little ride. Or when I get out of work, I'll need 10 minutes just to myself to just unwind. And then I'm just back, but I crave and need those 10 minutes. If it's in the car by myself driving, or if it's just listening to some music, I've realized that that's as helpful as certain things are. And I think everybody should do that.
Yeah. You guys both mentioned music, and I like music a lot.
Me too.
And I want each of you to name 2 or 3 singers or groups that you really like.
Ooh, the Beatles.
Wait a minute. How'd you know I like the Beatles? Do you think
I love the Beatles.
You do? Do you know who John Lennon is or not?
Yes.
Was he one of the Beatles?
Yes.
I look like him. Even if you don't think I do, say that I do. Ariana, say that I look.
I'm a big fan of Paul McCartney.
You're a Paul McCartney guy?
Like Paul McCartney.
Yeah.
Other music, ABBA.
ABBA? Yeah, nice harmony, huh?
Oh, modern. I like some classical music, no, I meant something else. What else do I like? Something modern. I like a Justin Bieber song. Just one Justin Bieber song.
Okay.
It's called Flowers. So
all right.
I enjoyed the song.
Okay.
I like Beyonce.
Oh my, yeah.
Oh yeah.
Beyonce, yeah. She's still married to Jay-Z?
Yes, she is.
All right. He's a musician too, right?
Yes. Yeah.
Give me another one you like besides Beyonce.
I like Megan Thee Stallion.
Ooh.
I do.
You know her?
Yeah.
What's she on? I must be old.
She's a rapper.
Oh, she's a rapper.
Yeah.
Okay.
Her music is really good though.
Cool.
Yes.
I try to not listen to trap music.
Okay. What do you got, Ariana?
I think my favorite bands, I really like this, there's a new thing called pop rock, so it's opera and pop music mixed together.
Whoa.
And there's this Italian opera group called Avevo. They're amazing. Their voices are beautiful, just really interesting to listen to and be a part of like the Italian culture and not know about them. And then I also love, I really like Ariana Grande. I love her music. I love her in Wicked. Just all her songs are just so inspiring and hopeful. I'm a huge Cher fan. I love Cher.
Cher, wow, where's that one coming from?
I just love
She's
Cher.
from quite a long time ago, huh?
And then my last one is Todd Hall. He's an LGBTQ music artist. His music is just very pop, Broadway, mixed together.
Oh, wow.
It's very, very fun, very outgoing.
Yeah.
Just really
Cool.
fun music.
Yeah. Mr. Glazer?
All right, before tennis, AC/DC.
Okay, hold on.
To get me fired up.
Yeah, all right.
Jay-Z, I love Jay-Z. I've seen him
Jay-Z.
live like 3 times. Let's see, in the last one, right now, I'm big into Mumford and Sons. And just telling you about their music gets me, just like Jay-Z. I don't really understand why I love his music so much, but there's something, it might be the beat, I'm not sure, but his music honestly speaks to me. I don't know why, but like I can't get enough of his music.
Wow.
Queen.
All right.
Yeah.
In Celtic Thunder.
Ooh, wow. Wow, one more.
Journey.
Oh, wow.
Journey's great too.
Journey's old school. Yeah. Well, you guys, you did a great job educating the audience about important issues, and thanks for letting me participate and talk with you guys.
You're welcome.
And
thank you.
Anytime.
Anytime.
I would actually like to thank Dr. Pulver and all the other doctors and parents, guardians, and everybody else for being here as well.
Thank you for having us.
Thank you.
Thank you.
Well, thank our panelists for sharing amazing insights on difficult topics. A thank you to our wonderful and skilled moderator, Dr. McDougall. Yay.
Great job.
So there is tea, coffee, and snack out back after we give a gift bag to each of the panelists, graciously provided by the WSA.
Thank you so much.
Thank you, Sarah. Thank
This
you.
is my first panel, by the way.
Oh, you did-
My
you guys
second
were
time.
Great. There is tea, coffee, and snacks right out back in the hall. So feel free to consume and converse before you head off. Thank you for coming. We had over 100.
Thank you guys for coming.
Woo-hoo! Very pleased. Thank you. You guys were amazingly insightful.
I was very nervous.
You guys were great.
I was never nervous.
Yes. It's on.